really manage our time. And for our audience, I want to request that we have a few housekeeping points. And to our panelists also, a few housekeeping points that manage the time. Please be more direct in terms of articulating your issues. And for the audience, please ask direct questions. And I want to request that all of us have a piece of paper, right? Yes, so as they present, please make sure that you use your piece of paper to jot down your question. And I have my support team here who will pick the questions and I will read them on your behalf. If time allows, then I will allow the audience to ask a few questions, just for us to try and manage the time that we have here effectively, because we only have like 40 minutes. So thank you so much for trying to abide by that. And I'm going to have Brenda Otieno, who is going to share with us. Just sit. Yeah, just sit. So Brenda Otieno is going to share with us on a topic called Caring After Birth, exploring the realities of postnatal care for mothers and infants in Nyakach, Kisumu County. So you're not going to have a presentation, but I will ask you a question and allow me to move to this side and now ask you your first question. So we will have the round of first questions and then the round of second questions. So considering your topic, Brenda, and having undertaken this study, could you share why postnatal care is critical for the survival and well-being of both the mother and the newborns, especially in the rural setups that you did this research?
Thank you very much, and thank you, teams, for being here today to listen to our papers. I think for us, we would want to reiterate the importance of the postnatal care phase during care, because one of the key issues that is rising up currently is that there's a lot of evidence that suggests that most of our mortalities, both for the mother and the child, occur during the postpartum phase, and is most especially within the 7 days after delivery. So this particular phase is very important for us, or to us, because we are looking at issues risk mitigation. If you're going to catch these risks early enough, then we need to really put in a lot of investment in looking at our mothers and our children's health after delivery. Then we're also looking at catching up or managing some of the complications. For those of us in maternal health, we also know that currently we have the highest number of maternal mortalities in our country. And also when we look at the neonatal mortality rate is very high and beyond even what is recommended us with the SDGs. So for us to also catch these complications early and of course manage them, we need to really focus on this particular phase. We're also looking at issues concerning the support that we give our mothers. And we will agree as the choir for the ECD. We always say that the mother's health, mental health, is very important for our child. So if we have a woman that is not mentally well, then again we cannot assure that the child that has been born will be mentally well or will have improved health. So again, we want to ensure that we are giving our mothers and our children that comprehensive support. And this is the phase whereby we encourage comprehensive breastfeeding, exclusive breastfeeding, We are looking at issues nutrition, both for the mother and the child. We are looking at issues mental health, which is currently on the high. And also, we are currently seeing a lot of incidences of the postpartum depression. So this is the time that we want to catch that and, of course, ensure that this particular negative impact on health is not being passed down to our children. Then again, we know, as the national government, we know our guideline on our care after birth, of course. So it's part also of the continuum of care, where we are looking at the whole health of our mothers and our children. Thank you.
Yeah, thank you so much, Brenda, for bringing those particular insights in terms of this topic. And good to see the insights in terms of risk, management of complications, supporting the mental well-being of the mother as some of the key things that we are looking at. And so I want to transition to Pamela. And while you are holding that thought, Brenda, I will come to you with another question, but let me transition to Pamela. And Pamela has a topic on co-creating solutions for maternal and child health, basically looking at the role of healthcare providers and healthcare promoters in human-centered design. And so, Pamela, could you just highlight to us, human-centered design is a problem-solving approach and prioritizes the people, basically putting the people at the center. And so could you share how you have used this approach to improve healthcare providers' capacity to integrate nurturing care for early childhood development? Thank you.
Thank you. Good morning to everyone. So for the creating for the solutions and the human-centered design, we were implementing nurturing care for quite a number of years, but now there was a mislink somewhere, and we felt that it was important for us to bridge this gap. So in this, the practice bit, as much as the caregivers were coming to us in the facility, maybe we could have some sessions within the facility, but what was happening back at home, there was still the practices now. So as a result of that, as a team, we came up with the human-centered design to come up with
the mic, team, please.
Sorry for that. So we came up with a solution to bridge this gap. And in that solution, number one, the caregiver was now put at the center, the person who really implements. Because if it is at the facility, maybe the mother or the caregiver will be there, or the male partner will be there, maybe for at most 1 hour or so. What happens to this child the remaining hours? So in this, we started by trying to understand, to empathize, what is this that is happening in the community. So through empathizing or discovering what was happening in the community, we discovered that there was a gap when it came to now the responsive care to these young children. So after empathizing and trying to discover, we got into a process of co-creation. And in the co-creation process, we held the community health promoters, we had the caregivers, and we also had the healthcare providers trying to co-create what can we do best with these different players. And on doing this, we now moved to prototyping. And in the prototype, we developed with the 3 players and the other stakeholders also, we developed what was now trying to bridge this gap. And in the end run, we discovered that indeed the gap was bridged. So after developing the prototype through the testing of the solutions, we dealt with now capacity building. There was a gap. Because in this gap, the gap that we discovered that was there, as much as we were giving some information, some dosage to the caregivers, but it was not the same across. And through the capacity building, the healthcare providers' capacity building was done. The community health promoters' capacity building was done. Then to the caregivers, capacity building was also done at the household level. Other than the facility, it was done at the household level because in SIA we have 100% household coverage. So after the capacity building, we now started implementing these in 2 facilities. We had 2 facilities with the implementation, then we had 2 facilities that were acting as our control sites. And interestingly, there was an increase in the indicators that we were looking at. And this showed us that human-centered design, in everything that we plan to do in the space of nurturing care, can we involve the people that are mostly there for us to get the correct solutions to the problems. Thank you.
Thank you so much, Pamela. Key thing coming out there is co-creating with the user, coming up with a prototype, testing that prototype, iterating, and then finally landing the solution. Thank you so much. While we pause at that, we'll come to your learnings, but I want to transition to my colleague and from the finance perspective, and I know you had a paper, and your the main focus was basically looking at the effect of enrolling 3-year-old children to pre-primary on women economic empowerment. This is evidence from a randomized controlled trial study in Tharaka Nithi County. Anyone from Tharaka Nithi County in the room? Yeah. Okay. Sawa. Your study is here. Thank you, Mr. Onditi. And from this study, basically, I would like you to share with us on how you think women who have access to childcare services are more likely to engage in paid-up work and other entrepreneurial ventures, thereby contributing to higher household income within their settings.
Thank you. Thank you very much for this opportunity. It will be best if I give a background so that we can connect with the question. The Kenyatta University Women's Economic Empowerment Hub is conducting a randomized control trial study in Tharaka Nithi County, basically having a treatment group and a control group. The treatment group comprises of 58 schools enrolled and 60 schools under the control group. Now, we are pursuing 2 outcomes. We are pursuing an outcome on child development, and we are pursuing a second outcome on women's economic empowerment. So my colleague, Dr. Eunice, will be speaking to the outcomes around child's development, while I'll be speaking to the outcomes around women's economic empowerment. Now, we have a very interesting, innovation in terms of a curriculum, which we are using as the intervention. It is a modified curriculum. It has been assessed by KSCD, and this curriculum is a play-based curriculum. It has mentors and caregivers who are delivering this to the target group, the children. But then these children come from homes where they are mothers and parents. Now the study, or what I'm about to present today, is trying to see if there's any nexus between having these children enrolled in school and women's economic empowerment, entrepreneurship, and other income generating activities that they engaged in. We all know from literature that the burden of unpaid care work, and particularly childcare burden, is a constraint to women's participation in labor market. We all know this. So this is what we are trying to bridge the gap in. In Africa, there are not many studies that have assessed this particular issue between the nexus between enrolling a child in a care center, in this case 3-year-olds in the ECD programs, and the women's economic empowerment. So it's an interesting study. The preliminary findings, of course, this is based on baseline data that we collected. That preliminarily, we are seeing very interesting outcomes, especially in women's economic empowerment. One of the interesting things that we are seeing is that a woman's age is quite critical in her engagement in economic activities. There are the active working years that women, and these are, unfortunately or fortunately, these are also the childbearing years. The active working years are also the childbearing years. So there's a clear nexus that for a woman to actually be engaged in economic activities and at the same time take care of the children, there's an opportunity cost. So what we are seeing is that relieving mothers the burden of childcare and taking these children to a center where they are learning, they are engaged, and the mothers know that the children are safe there, is helping them to work effectively and participate effectively in labor market. I'll share a bit of the findings later, but for now, I just want to give you those forward understanding and background of this study. Thank you.
Okay, thank you. Thank you so much for bringing that particular background. And yes, indeed, this is a very critical topic. And I know it resonates with all of us. Sindio? Yes. Hata wewe ukiambiwa saa zile house manager amepotea asubuhi, umetoroka job, sindio? On a light note. Thank you. And transitioning to Daktari Mvungu here. And please share with us a bit more on this topic on the status of self-regulation skills among 3 to 4-year-old children in Tharaka Nithi. Basically, this is from the baseline assessment that you conducted. Yeah, if you could, a bit more of the background and some of the key learnings here. Thank you.
Okay, thank you, Chair of the panel. Good morning, everyone. So like you've heard, my name is Dr. Eunice. And yes, riding a little bit on the general introduction given by my colleague here, I would just want to add that the baseline assessment in the Tharaka Nithi County focused on, among other things, evaluating self-regulation among the 3-year-old children. Now, to put us into perspective, it is important we understand what we mean by self-regulation. So when we talk of self-regulation, we are referring to a child's ability to focus on attention, manage emotions, control impulses, and behave in a socially appropriate manner. Now, self-regulation skills comprises 3 core components, one of which is attention regulation. When you talk of attention regulation, we are referring to the ability of a child to focus to a given task or to tasks. And the second component is behavioral regulation, and this has to do, for example, with rule following or taking instructions given. And finally, is socio-emotional regulation, which is about how a child manages their emotions. Say, for example, in a scenario whereby a child grabs a toy from another child. So the victim, in quotes, you look at how does she or he react? How does she manage the anger that she finds herself in after the toy has been grabbed? Now, research done globally has indicated that deficit in these self-regulation skills, especially among the preschool years, is linked with poor academic performance, social challenges, and socio-emotional issues later in life. Now, to precisely respond to the question asked, I want to say that self-regulation is essential for children's success in the early learning, and this is because it equips them with the ability to focus on tasks given. You know, like in a formal school learning, in a formal classroom environment, there are tasks to be given. So, does the child has the ability to focus on the tasks probably given by the teacher? Then, is this child able to follow rules given, say instructions? And finally, are they able to manage their emotions as they interact with their peers and the adults, say like teachers? And this, is, of course, is very essential for navigating a formal classroom environment. So I hope with that I've been able to respond to your question.
Thank you so much, Daktari, for bringing those background and the perspective in terms of making us to try understand more about the regulations and what that means. Thank you. I will pause at that point, and I'll come back to you with, to share some of the key learnings But I know a few colleagues joined in when we had started. We had a few issues of housekeeping. We said that if you have a question, please jot them down in a paper, and I will have someone collect them, and then I will read them. So just indicate your name and your question. And as I want to transition to the second round of asking my panelists some questions, I just want to take a moment and recognize the First Lady of Bungoma County, Dr. Margaret Makelo Lusaka, who is in the room with us here, listening and learning. Thank you. I move on to Brenda. And your study on caring after birth, exploring realities of postnatal care for mothers and infants in Nyakach. Could you speak to us on some of the urgent issues that need to be strengthened to support postnatal care for mothers and infants?
One of the key learnings that we got from the study, which would recommend as one of the urgent things that need to be really addressed, is for implementers and even the government in itself to come up with community-based initiatives that would strongly improve education and, of course, also scale care outreaches within the community level. Because we did realize that during the study, when we were talking to postnatal mothers, they had a lot of challenges, and some of them leaning towards the systemic gaps. Some of them were based on terrains that they were having. Others were social cultural issues. Others were, of course, linked to even the kind of autonomy that they have as women. So out of all those findings, we did realize that one of the key issues that really, really needed to be strengthened have to be done at the community level, and not having these women probably go to the facility system. But then that linkage is also very important. But how best can we have community interventions that mostly target education and, of course, target scaling care at that home level where they are? To speak in details, probably, I would highlight one of them is health education. And one of the things we are looking at, even as we talk about health education, we were looking at even the providers in the facility. Some of them have not been given, we can call it the in-service training, given updated knowledge on what is required when we are talking about postnatal care. Some of them have not had any sort of refreshers or any sort of even the ECD training. They do not know. So even when these mothers go back to the facility, they do not know what to tell these particular mothers. They'll be sticking to the routine kind of care. We have the cultural sensitive information. We know in our societies we come from cultures. We had women who were even told not to go to the facilities for 40 days. I don't know whether it happens in your community. But back where I come from, there are some cultures, some religions that prohibit women from going outside 40 days after delivery. So for us to even reach these particular women and ensure that they are going for those postnatal care, then we have to address such kind of cultural sensitive information. Then we have CHP empowerment, that is community health provider empowerment. Key gaps that we did realize during that time was that most of our CHPs, in as much as they are the lifeline to these particular mothers, and they are doing their work very well, I would say, but then they need a bit of empowerment because we realize they don't even have the tools. We go to these homes, but what information or what package of care are we giving our women? So probably they would just go say, hi, how is the baby, how are you, and leave. But then we feel they need more package in terms of package or content that they are sharing with these women. Then again, we are looking at the checklist. Our supervisors, the healthcare system, the providers, the county. Do we even supervise and see, or do we have a way of even measuring or having accountability checks with these our CHPs? Whether they went to those homes, I know they have their targets and they will check their boxes, but are we having any kind of checklist to ensure that a number of services or a number of items was done, or maybe they did a couple of things? Then we're looking at also the tools. One of the key gaps that we also realized in our facilities we realized that even the mothers do not have the mother-child booklet. So the mother cited that there was a time they were not given. We will confirm. But then that was another gap. Because now without the mother-child booklet, most of them claimed they did not see the return date. So they are not going back to the facilities. They don't know. Then we are also seeing in our facilities in themselves, most of our maternities do not have the postnatal care register. So even if they have, then they are not utilizing. The other thing that was coming out also very strongly was on service integration. Our women go back to the facilities, yes, for the few that went back. But when we go back to the facilities, probably just for the immunization service. But during immunization, are we even looking at the babies? The stimulation, the other components of nurturing care? Are we having our providers checking that? Or we are basically just immunizing and moving on forward? So we realized that a lot of complications were not being picked up during the postnatal phase. So the children come to us at around the 4 or 3 years now when they're getting into the ECD. Then you start realizing they're having those delayed milestones, they're having the autism spectrums and all that. But these should have been picked earlier during the postnatal phase and probably given the necessary care that they needed to resolve those issues. Male involvement. Again, I don't know about your communities, but for these particular communities, there was a cry. And they were talking so much that they needed the male to provide that supportive care postnatally. So we even have 2 cases. One, we were seeing a lot of the men eating chakula ya watoto na kukula chakula ya mama. So men, I don't know if it is just our community, but men, please, mama akitoka kuzaa, allow them to eat well and allow them to feed their babies. The other thing that the women were citing was also the sport pesa thing. I think it is betika or what, the betting issues. Right now, the men go to work, they collect their monies, they take the monies to betting.
Okay.
The women were also complaining. They save a little bit for their care, the birth planning and all that. The little money they save, the men pick and go for betting. So for us, I think the priority for us right now is those community-based interventions that are going to improve the education and are going to ensure that postnatal care is really, really reaching down to the community, those outreaches.
Thank you so much, Brenda. Very good points there in terms of tools, in terms of dosage, what content are we giving, integrating services, key, and then male involvement, as well as also looking at some of the cultural issues. I know we are supposed to end by the next 5 or 7 minutes, and so being cognizant of that, allow me to jump to Pamela, and please share some of the key critical learnings, if you can summarize them in a very good way that you know. Thank you.
Thank you. So few lessons that we learned from the human-centered design co-creation was 1, integration of nurturing care into the routine services is very key. It is key because when we look at, right from yesterday, a number of us delegates were still confusing ECD to ECDE. So before we talk of this child of school-going age from 3 years, we have 0 to 3 years, the first 1,000 days. So when we look at this integration of nurturing care into the routine services, we have the bit of the different touch point areas within our facilities. 1, we have the antenatal clinics. So in the antenatal clinics, if they come as a couple, the male partner is also encouraged to talk to the baby while the baby is still in the utero. Because many people assume that the baby cannot hear before maybe certain months. So we have the antenatal clinic, we have the postnatal clinic, where the entire family is also encouraged to talk and play with this young baby. Other than the postnatal clinic, we have the normal child welfare clinic. In the child welfare clinic, so as these babies come to the facility, they should not associate the facility with a place where they'll get pain, but with an area where they can play and enjoy being in the facility. So as the caregivers come while they're waiting to be served, Play items in various facilities are placed. Then as they wait, health education is taking place, then the children can continue playing. Another key area that we also learned is the development of the standard operating procedures. And in this, we used the national card, which is our MOH 216, that is used for antenatal care. And this was also part of our recommendation that other than us just to continue issuing the mother-child booklets, it's important that healthcare providers be frequently updated. Because the booklet is so useful and rich in information, but it is not being used. Maybe from the level of a healthcare provider, at times due to staff shortage, there is that task shifting. You only, once maybe the biodata has been filled, you move to the page where you're going to palpate and write your findings. So the use of MOH together with the SOPs. So these SOPs were developed in line with the MOH 216. For example, like we have page 25 or 44, where we check for the delayed milestones. The caregiver can do this back at home. The mother should be able to know that maybe at this month the baby should be able to lift their heads. Then on the SOPs still, we have the counseling cards. Like if it is in a session, this baby between 0 to 6 months can play with these particular play items that are safe. 6 months to 1 year can play with these particular play items, then 1 year to maybe up to 2 years.
Okay, thank you, Josephine. I will have to cut you short and ask KU team to provide for us the learning, I think in summary. Yes, please.
Thank
if
you.
You can
Thank
combine
you.
both. Yeah.
Thank you very much. We constructed women's economic empowerment around Kabia's definition of women's economic empowerment, basically looking about the components of agency and decision-making, access to opportunities, and also control of productive resources. And what we have seen out of the baseline data is that the effects or the relationship between enrolling 3-year-olds to school and women's economic empowerment are more visible where women are vulnerable and in low-paying jobs. What do we mean by this? The higher you go or the more income you earn, there's a likelihood that you will be able to have a caregiver, so that enrolling a child to school at 3-year-old might not make much difference. But for the low and vulnerable women in the rural areas, this is a big, big boost. And we know that majority of the women are actually in the rural areas, and they are engaged in entrepreneurial activities, they are engaged in businesses, small businesses, and so this intervention is more meaningful and most meaningful in those conditions, including in urban centers where there are slum-like conditions. So this intervention will be more meaningful in those areas because these women will greatly benefit and will have the time to participate meaningfully in the labor economy.
Thank you.
We also saw that, just one last point, we also saw that health and education are critical factors to women's engagement in economic activities. The healthier a woman is, the better or the more engaged she will be, or the likelihood that she will engage in economic activities is. And so I concur with my colleague on her finding. Of course, there's the issue of our social norms. The way we have normalized ourselves. There's an issue there. And it comes across almost all these studies. When you read literature review, you see this issue of patriarchal society. It cuts across all the issues. So maybe our next studies and our next thinking should be, what do we do with these many negative cultural practices which appears to be lowering and putting the women down, sometimes even disengaging them from economic activities. Thank you.
Thank you so much. Daktari, finally, if you can share one key learning that can be number one, and then answer the two questions in 1 minute.
Okay. Yes. One of the key findings is that we didn't find that majority of children exhibited above average self-regulation skills in all the three domains I mentioned, that is attention, behavioral, and socio-emotional. This means that these children, the 3-year-old, can actually be accommodated in a formal school learning. That is the key lesson I've decided to pick on. Some of the questions that I have 2 questions here. One of them is how do you equip caregivers to manage the 3 regulations, that is the 3 domains, attention, behavioral, and socio-emotional. I want to say that our standard did not delve into this. But generally what I would say that this should be food for thought, because I do not have very specific factual responses on how we can inculcate attention, behavior, regulation, and socio-emotional regulation, socio-emotional regulation. But it is important to know from psychological perspective, the environment in which a child finds themselves in, children find themselves in, starting from home to church, to school, to the neighborhood, has a lot to do with the outcome and the exposure that they get on how to, on the 3 domains. So that let me not say that I have a specific response for this because it's a very broad area.
Thank you.
The other question is, in terms of child's emotional regulation, as early as 2 years, running to 3 years plus, what strategies can you employ to make the child understand the boundaries in cases where the child uses manipulation and attention-seeking behaviors to get their way? Now, okay, I want to say that similar to what I've said, this is a very broad question, and we know we have as many parenting styles as we are. All of us do parenting in a unique way, but most importantly is the way you handle your child. The way you handle the child, the environment, the exposure you give that child will determine whether they will manipulate you or not. In fact, if they are manipulative, you need to ask yourself why. And that makes me feel like it is good to research more, read more, attend parenting related trainings so that we can learn this. So from the findings perspective, I do not have responses that I can draw from our study in Tharaka Nithi.
Thank you so much, Daktari. And I appreciate your responses. Please, maybe you can do a follow-on one-on-one conversations with that.
Yes.
And yes.
Can I also kindly add that this paper has been done by many of us. All of us are here. We have the county government of Tharaka Nithi, my colleagues, Dr. Gashara there, Dr. Onditi, Dr. Oteo, CEC Naivasha of county government of Tharaka. We have Professor Onywere, who is also familiar with this. So when time allows, they can come in and maybe give responses to some of these questions that I wasn't set for.
Yes.
Thank you.
Thank you so much. There's a general question here, which I know my panelists are not able to answer, but anyone in the room can just take a minute to answer, especially from the education and health. Mr. Mohammed Hassan asks that we have some children who are suffering from eye problems, i.e. they are short-sighted. As for themselves, they cannot identify their problem. How are the teachers trained to identify such children and advise their parents accordingly? Yes, in 1 minute, please answer that. Just direct to the point.
Thank you. Good morning, everyone. My name is Mishi Sylvia. I'm here with Aga Khan, but I work with Save the Children. as an education officer. So for children with disability, because short-sightedness, it's a disability, normally as a teacher, you are just supposed to refer the teacher to the right place. That is, the learner should be taken to the EAC center for him or her to be assessed for better placement. So the teacher has nothing to do with identification and assessment of the learner. Thank you.
Thank you so much for being direct. Refer, you've identified the problem, refer to the relevant point of services and they will be assisted. I would have really loved to continue, but I will have to stop at this point because I've eaten 5 minutes of the next panel time. And I know, McKenna, you will allow 5 minutes extra for the other team through the chair. Yes. So I want to say thank you so much for my panelists for doing a good job in summarizing your studies and sharing with us. Please just mark them. If you have a question, you can just interact over lunch break or evening break, and you can get more insights. And also, we are going to publish all these abstracts and presentations, and you will be able to also follow through that. So without much further ado, allow me to ask the panelists to stand up for a photo with me. I don't know if there is any photo somewhere. If that is delaying, then just let's, okay, yes, one photo is coming there. Obare, are you there? Co-presenter with Brenda, are you there? Please come. In 1 minute, please. Okay, please, let's do it faster. Okay, that is done. Thank you so much. A round of applause for the entire team. A round of applause for the session chair. Thank you so much. Thank you so much, Prof. Amenisalimia. Yes, thank you so much. So allow me to end the session and thank you so much. My name is Deacon Somedo. I am a board member for the ECD network. I work for PATH and in the early childhood development space. The second session is coming in and I would like to ask that the session chair to come and take over. There is panel 1 happening in Kifaru, led by Dr. Benta Ouko, and panel 2 is happening here at Swara, and this is going to be led by Dr. Roslyn. So please, Dr. Roslyn. McKenna, can you remind me the topic for Swara? Yes, you are the next session chair. Yes. Do we have all the delegates here now, or there are still other breakout? Thank you so much. Allow me to usher in the next chair. A round of applause to everyone. Thank you.
Okay. Good afternoon. Forgive that I'm still panting. I was presenting in another room and our room has delayed. But here I am. And we want to have our next session where we are having a panel. And I want to invite my panelists here. I think we have the seats ready. So if you are there, Lynette Kaloki. Lynette. Okay. Ambrose Orege. I know there are sessions that are still going on. Silas, Dr. Silas Onyango. Dr. Silas Onyango. Professor Simon Onyere, at least. You can sit anywhere. But I can see we only have Prof here and the rest are not here. Can I be guided? And then Jane Kariuki from UNICEF. Jane Kariuki. Nelias, we don't have panelists here. You are with her? Okay, so are you the one standing in on behalf of the group? So Lynette Kariuki is part of the, Lynette Kaloki is part of Kevinson Mwangi, Daniel Rabok, Amina, and Anil. But it's Lynette who is presenting. I'm being guided here. They go look for them in Nyati and Kifaru. Anyone, if you have their phone numbers, you can call them. Evans Mnuve, yes, you are here. So Dr. Silas Onyango and their team, no? So as we wait for them, I think I can start saving time by introducing these ones who are here. I'll begin by introducing Professor Simon Onyere. He is an associate professor in the Department of Spatial and Environmental Planning in the School of Engineering and, what is AMP? And Architecture, Kenyatta University. And he balances both academic roles and with impactful research and community engagement. Professor is currently leading a Gates Foundation-funded study on preschool intervention on the effects of child learning and women's economic empowerment in Tharaka Nithi County. During the Jubilee anniversary of the Regional Center for Mapping of Resources for Development on 16th of June, he was recognized for his role in mentoring many young researchers in the use of spatial knowledge and technologies. In October 2020 to 2021, he was the government multi-agency technical committee that assessed the socio-economic impacts of rising water levels in the Great Rift Valley lakes, Takwel Gorge Dam, and Lake Victoria. And I'll skip some of the things. He specializes in integrated environment management, developing participatory catchment management plans for communities. He led disaster risk management studies and training across East Africa, including IGAD states. Currently, he chairs KU's Global Tourism Resilience and Crisis Management Center board and actively contributes to the ECD network in Kenya. Thank you. As Silas breathes in, allow me to, let's appreciate Professor and clap for him. Thank you. Lynette Kaloki, you can raise your hand. Yes. She is an ECD specialist with over a decade of experience leading community-based programs and research across East Africa. She currently serves as an ECD technical specialist at Aga Khan University, focusing on gender-responsive childcare and system strengthening in Kenya's ASAL regions. Lynette holds a master's in child development and is passionate about advancing equitable, evidence-based solutions for children and caregivers. A round of applause for Lynette. Thank you. And then we have Dr. Silas Onyango, who has just walked in and as is panting. Dr. Onyango is an associate research scientist in the human development theme at the African, or popularly known as APHRC. He leads various research projects within ECD unit. Dr. Onyango holds a PhD in public health and epidemiology with a focus on children's developmental outcomes for the Swiss Tropical and Public Health Institute. And I'm trying to, he also has a master's science degree and a concentration in ECD for children with special needs from the Norwegian University of Science and Technology in Norway. He has a bachelor's in early childhood development and education from Kenyatta University. He's passionate about understanding how childhood experiences influence lifelong outcomes. With extensive peer-reviewed publications, Dr. Onyango firmly believes that all children, regardless of their cultural background, race, blah, 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 are treated with dignity and equality. He advocates for protection, promotion, and support of early development through evidence-based health educational interventions. A round of applause for Dr. Silas. Thank you. And I know we have Dr. Evans, but I don't seem to have his profile. Evans Munuve, and maybe you can give us just in one sentence. Okay.
Good afternoon. I'm Evans Munuve. I work with the Ministry of Health. For the last 35 years, I've been working with the Ministry of Health. My basic trainings are occupational therapy. I've specialized always in therapy. I have BSc in speech and language therapy. I have basic and advanced in Kenyan Sign Language. And also I've done studies in autism and the like. My specialty is in children. Currently, I'm the program manager for Early Child Development, Ministry of Health, Ramka Division. That is the position that I'm currently.
All right. Thank you very much. A round of applause for Dr. Evans Munuve. All right. So welcome to this panel. And in this panel, if you have the program, you are aware some of these presenters and what they're going to share with us. And I have a set of questions that they'll be responding to us as they share with us findings of studies they have done, and all of them touching on the different aspects of children's life. I think from yesterday, you know, I am Dr. Roslyn Olumbe, and I head the Institute of Child Development at Daystar University. And I will start with Lynette Kaloki. And their topic of their study, of course, it's a team. We have Kevinson Mwangi, Daniel Rabok, Professor Amina Bakar, and Dr. Anil Kamis, who are, part of them are here. They can raise their hands and you see them. Yes, right there at the back. Their topic is caregivers' mental health and the strengthening of early childhood development systems, research findings from Isiolo and Lamu, Kenya on Care for All. So Lynette, we are so delighted that you are here to share with us what you found out. Your study seems to highlight an equal burden of the unpaid care for Kenya's ASALs and its association with the mental health, especially among women. Now, given these findings, what particular policy interventions or community-level strategies would you recommend to reduce this emotional toll? Maybe you can speak to that. I'll just say, as you speak to that, you can give us like in 1 or 2 sentences summary of the study, and then now you answer my question.
All right. Thank you so much, Dr. Olumbe. So as Dr. Olumbe has mentioned, the study is on unpaid care work, and mental health is one of the variables that we were looking at, although it was not like the main highlight. But since that
seeing that caregivers are really taking care of children, taking care of people who are not well, that is the elderly, the sick. So this was an aspect that really came out from our findings. And looking at it, we noticed that most of our caregivers had really high levels of depression and anxiety. And so from the findings, we were able to use the PHQ-9 and GAD-7, as well as the WHO-5, just to be able to measure the levels of mental health challenges that they were experiencing. The study being in Isiolo and Lamu, it's part of the ASAL regions, and it was really a high prevalence. Depression and anxiety were really high in both counties. But now we looked at it in general, and we realized that the symptoms of depression were at 30.2%, while those of anxiety were at 18%. And among the female, it seemed to be quite high compared to men. And so we wanted to see how we can be able to support these caregivers, because they're taking care of children. So our study is focusing on 0 to 6 years mainly. And so looking at the policies that we would want to be implemented, and one of it is integration of ECD systems, or rather even mental health support in the ECD systems. Because these caregivers are taking care of children, they need to be able to, get the support from where they're leaving their children at. Given that we were doing the study in these two counties, we realized that majority of them are not taking their children to ECD centers. Mm-hmm. And now this burden is on women, and we're not saying it's not on men as well. However, we found it was really high on the women.
So the policy recommendation, what would you say, like in one sentence?
So I would say in one sentence is that we need to be able to strengthen the community-based mental health systems so that we can be able to support these caregivers, both at the community level and also at the national and county level.
Okay, thank you. And I'll still come back to you, but at this point, allow me to move to Evans Mnuve. And Evans has already introduced himself, and he was part of a study with Petrovic and Jane Kariuki, and this is their topic: using community radio and social media platforms to reach male and female caregivers with nurturing care messages, learnings from Kenya Kua Kocha SBCC campaign. Now, Bwana Evans, maybe in 2 minutes, would you just give us like a summary, and 2 minutes, a summary of what was this study before I give you my very first question?
Thank you, Doc. Ours is just a summary of a campaign that has been piloted in Kenya in 6 counties. We started with developing that as in Kenya, as you know, nurturing care was adopted in 2018 after it was developed by WHO in the same year. And we have been able to push for the government ownership or leadership. And out of the documents that we have developed, you have a draft integrated ICD policy. We have advocacy strategy that is still also validated, but it is awaiting the ICD policy. We also developed SBCC strategy. And in the SBCC strategy, there is that component of Kua Kocha, which is a campaign targeting the caregivers, the primary caregivers being the mother, or rather the female, and the father, and then those who support them, maybe whether it's a friend, whether it's a father, a grandfather, that kind of thing. So Kua Kocha campaign, when we did our desk review, it came up with the 4 strategic issues, which was low awareness, gender issues, limited adaptation, and reduced kingship. And majorly we were focusing on Garissa and Kisumu. But the essence of the campaign, it is adapted for each and every locality, like the counties. So that is what we did. And the campaign was now to target these our caregivers, through maybe radio sports, social media, and the like. And we were looking at to reach them, mostly engaging the men. And the study, if you see the paper, actually it is visual oriented, very many pictures whereby it depicts the man assisting the lady or the female caregiver and interacting with the children.
Thank
so
you.
that was the essence of the campaign, to reach and maybe uplift the male engagement.
Thank you. Thank you very much. And I think that's very good as we think about the male involvement and all that. And so from the work that you've shared with us, the data shows that messages reached a very significant number of both male and female audiences, and mainly through the social media. However, when you refer to targeted audiences, could you please clarify how you ensured that the intended recipients, particularly male and female audiences, actually listen to the radio content?
Well, as a preparation of the ground, we aim to understand each and every community, the most listened radios, and at what time male and female are likely to listen to them. And that is when now we aim to look for airtime during that time. So generally, after that, there was an external monitoring agency who was recruited after the spots were given. Because like the counties that you in, even most of them are here, they have been participating in those shows. I know they are in the rooms. So we now we want to know actually what is the percent. So it was, we used an external monitoring agency which was engaged, and their reports indicated the data that we have presented. That the number of shows that we are done or talks we are done, the number of estimated listeners and respondents, that kind of thing. So we had that short-term monitoring report from an agency that was hired. Yeah.
Thank you. And so that's very excellent that to be able to set up a monitoring aspect to help you.
Yeah,
Thank you.
sure.
I'll come back to you. I want to move to, I think Ambrose is not here. So I'll move to Dr. Onyango right next to me. And Dr. Onyango, together with their team, they worked on a study exploring the relationship between fathers' involvement in childcare and family engagement for children with developmental disabilities in Western Kenya. Silas, as we get into this and look at your work, looks a very commendable piece of work just like the others. Would you tell us, like in 2 minutes, a summary of this work and your findings before I get to my next question? Thank you.
Thank you, Dr. Lumbe, and thank you everyone who are here. I think what we did, this was not really the main focus of our study. We were looking at integration of nurturing care for children with developmental disabilities in Siaya County in Kenya. But then in the process of our analysis, something interesting came up depending on the questions that we were asking the mothers. So we were asking the mothers about the involvement of men, because men are a big question, even now in the room, their involvement in childcare, specifically for children with developmental disabilities. So our interest was drawn when we were doing analysis in this, and we decided that let's look at involvement of fathers. These ones are now fathers, and the involvement of fathers in childcare. And involvement was defined in 2 ways. One, their engagement with the children in terms of play and so on and so forth, but also in terms of support, where we were asking about buying food, fetching water, doing all those other things in that particular area. So, and then we looked at this vis-a-vis the involvement of the family. That is, children above 15 years, children above 15 years together with the mother of the house. So those ones were our outcome. And we're looking at the four outcomes, looking at cognitive, socio-emotional, and those other activities that they involve with the children. So it was support and engagement vis-a-vis the involvement of adults and that are 15 years and above.
Okay.
Yes.
Thank you, thank you. That's a good summary. And so when we think about and just across these studies that we are looking at, and generally in the country, one of our struggles has been the father involvement. And we say it remains an under-researched area, and especially many communities traditionally assigning the role of caregiving to women and not necessarily to men. And I think we've seen partly in Kaloki's work that actually helped us to see they were looking at the burden of caregiving being to the women. Now, this gap is mostly pronounced for children with developmental disabilities. And in one forum I've sat and it was said, when you get a child with disability, huyo ni mtoto wa mama. Or it's a child for the mother, because the mother atakufa na yeye, right? Ama ataanguka na yeye. Anyway, and so in that context, if really we see that, and you're talking about this, could you please share the quantitative findings on father involvement from your sample, disaggregated by region, because it will just help us to see the level of engagement, as you saw in your study.
So our study was only in Siaya County, so then we didn't have, unless we want to do the sub-counties in Siaya, but then we didn't focus on region. But what interests us is what you are saying about involvement of fathers in childcare. There is the question of involvement of fathers in childcare, but then there is a question of involvement of fathers in caring for their children with developmental disabilities. Those are two different things, because what we learned is that most fathers, when the children are diagnosed or they realize that they have these forms of disabilities, they usually go and start the other house, and they leave these other ones. And I think that's very common. So that is why our interest was, if they are really involved in childcare, what is the role that other people in the household do? Are they also involved? And that is when we talk about our quantitative findings, we found that in terms of their involvement in play, ensuring that the play materials and all these other things in the house, the families, members of the family, especially the mother, was also involved. So it shows that there was a synergistic kind of effect. When the father is doing, the mother is doing more. And that was actually more than 23% of their involvement. And that was a very strong finding. But in terms of support, that they buy food, they come, wash clothes, they do all these other things, we found it was not as strong as their direct engagement with the children. So for this support, we found about 13% increase in the family engagement. But for their support, for their engagement, playing and doing these other things with the children with disabilities, we found that the household is quite involved with the children. And then we also analyzed data from the mix, the UNICEF mix, taking the child out, walk reading with the child, doing all these other things. If the father is involved in doing these activities, then the family is involved 43%. Increase in the family involvement. So men who are in the house and men who are doing these other things, get involved in the activities with your children, because this one encourages the other part of the family members to come and contribute to the engagement with the child.
Thank you. Silas almost spoke his heart out, but thank you very much as you shared that. And before I go to my next question to you, I'd like to listen to Prof.
Yeah.
And Prof, presenting their work on childcare provision and women's economic empowerment in Tharaka Nithi, right? And so as we look at that, I would like just to find out from your work, and maybe just in 2 minutes, if you could just summarize that study, and I get to my first question to you in 2 minutes. Thank you, Prof. Don't laugh.
2 minutes, I can't do anything. But first of all, this is the study itself involves many stakeholders who are directly involved in the project. And in here we have a fraternity from Kenyatta University and a fraternity from the county. And the first thing I want to do for you to actually see that there's a big congregation is to ask them to stand up. If you are in any one way or the other involved in the project or looking at managing it in one way or the other, I know the VC's rep is here. We can't do anything without permission from the VC. The MCAs are here. Where are the members of...
We can give them a round of applause, and then Prof, you tell us about the study. Thank you. We applaud you.
So we have a big congregation here both from the county and from the university. The next thing I want to say is that the project itself, we are involved with the University of Yale University in the US, University of Bangor in the UK, University of West Indies in Jamaica, and our own Kenya National Bureau of Statistics. Remember, you can't do any statistics for policy making if the Kenya National Bureau is not working with you. So we are working with the Kenya National Bureau. They were supposed to be here, but I'm not sure why they didn't come. The project itself is basically, sometimes in 2020, 2021, we were actually doing a livelihood survey in Tharaka Nithi with the support of Tharaka Nithi County. And when we met women in the field when we were doing a livelihood survey, the mothers told us that they live for the children. Their livelihood is about the children. And they also told us that the biggest challenge they have about that type of livelihood is who to take care of those children. And they also told us a problem about climate change, which is a big issue, and they told us a problem about infrastructure. And we chose at that stage that we do a policy on the 3 items of challenge, and we did a policy brief on childcare. And the principle of childcare was basically to find a mechanism of leveraging on an existing crèche, which the Honorable Mudhobi has graciously nurtured in Chuka, and which has actually grown into a policy now that every market that is constructed in Kenya must have what? I think only the First Lady is speaking. The rest of you don't know. Every market that is constructed in Kenya must have a crèche.
Thank you.
I haven't finished because I haven't told you.
No, because I want to ask you the question now because your 2 minutes are over. Thank you.
Okay.
But I know I respect the gray hair, sir. But let's get to this question because it will still speak to what you need to tell me.
Fine, no problem.
Yes. So your baseline findings reveal that women spent nearly 3 hours daily on childcare, compared to only 30 minutes for men. Considering this, how does your intervention aim to relieve women's care burden, and what broader implications might be there for women's economic empowerment? I'll give you 3 minutes for respect.
For that one, okay. What you have done is a very simple process, but also very complex. Because after we did a design, and it's a long story about the design, we chose that if we gave an intervention on caring, school-based care for the children, and we choose one age group of children 3 years old, so we designed to take the 3-year-old children to school. But of course, the obstacle was that we don't have extra facilities in school to support 3 years old, and then another obstacle was that the policy does not require that, the policy of the Ministry of Education, so we had to go through the route of policy to develop a policy in the county to allow the county to take 3 years old to school, and we had to engage the Ministry of Education and other stakeholders to be able to do that. So we were allowed to take the 3 years old children to class as a test process. 1,500 children. There's a category that is in the control, and there's a category that is in the treatment. And in the treatment, we are doing a very simple process where we have an intervention that allows a curriculum that supports 3 years old and also supports the 4 years old, because we chose to put the 2 groups in the same class. And then we had to recruit a teacher and train the teacher together with the other teacher. So we trained them for about 3 weeks of training on how to actually take care of children. And these teachers, after they have been trained, they have another set of mentors, coaches we call them, who go to visit them every day in 1 week to go and coach them or to observe what they are doing and correct whatever mistakes they are making, so that they build their capacity to really focus on the child. And then we also developed a lot of materials. We have a booth out here, and you have listened to my colleagues also speaking. You can go to the booth and see the materials that we developed using local materials to allow the children to have the free play with the materials. And it takes me straight to what Eunice was not able to capture, that this is actually the process of learning in class that allows children to have self-confidence, to really enjoy learning, to really have this process of relating with others very easily and so on. So the issue of removing anger from them and so on is something that we did away with. So just through the classroom process. So this intervention of taking the children away to class, we assumed or we know that it has relieved the mothers of time for taking care of this particular 3-year-old child to allow the mother now to do anything else he wants to do. Actually, we have not told them what to do, and we have observed in the midline, and we have seen that actually the mothers have improved on the time they are spending in the market, the time they are spending in the farm, and also increase their time to engage with the child physically. And therefore, even the father's time there has increased in terms of engaging with the child.
Thank you very much. I think that's very great, and we appreciate that. And I want to come back to Lynette. I know we have an online presenter, and I don't know if he's able to speak right now before I go to Lynette. Ambrose, is he able to? The media team. And so as they get Ambrose for us, I know I had not introduced him earlier. I wasn't sure he was online. He is a dedicated community development practitioner with a strong background in public health. He has a Bachelor's of Science in Public Health from Jomo Kenyatta University and specializes in participatory methodologies, serving as a trainer of trainers, skilled facilitator in community engagement, communication, and risk communication in water, or rather basically WASH programs. He focuses on empowering communities through inclusive dialogue, but also behavior change and sustainable solutions. He is committed to fostering collaboration and building local capacity for long-lasting impact. Is Ambrose there? Yes. So Ambrose, you can hear me? And if you can hear, you can say yes.
Yes, I can hear you.
All right, thank you. So Ambrose, maybe in 2 minutes, could you just give us like a brief summary of your study before I give you my very first question? Ambrose, 2 minutes only. And maybe just to give us the title of Ambrose's work. Sorry, I need to read it for us here. Forgive me. So for their work, their topic is strengthening nurturing care through responsive parenting trends, outcomes, and lessons from Moments That Matter project in Kenya. So give us a brief summary, Ambrose, in 2 minutes.
Thank you, Dr. This was an endline study for an 18-month cycle project in Nyamira and Vihiga counties, where we are working with the caregivers at the community level to strengthen them in nurturing care. And through this exercise, we had great improvement in terms of results that were realized through the caregivers' involvement, both male caregivers and primary caregivers, and also the developmental outcome milestones that were achieved through the children 0 to 3 years in those areas of focus. Thank you.
Thank you, Ambrose. And so, Ambrose, if you can help us, looking at your work, we see that this model, it's actually very commendable because it empowers grassroots structures which are critical for sustainability. From your findings, we see that there is improvement in parenting practices, especially in Nyamira. But on the other hand, we saw Vihiga lagged behind. Maybe, which of the factors from your findings or from your engagement in this study, which factors do you think contributed to the disparities between the two counties, Nyamira and Vihiga? Thank you.
Thank you, Dr. Two aspects came out. One is the issue of the socioeconomic factors, whereby you find in Nyamira, there were quite enabled socioeconomically than the Vihiga. So that is a factor that came out, that you find that most issues of poverty came into play insofar as uptake and involvement of caregivers in the nurturing care activities were concerned. The other aspect was the issue of the gender norms still coming into play, affecting involvement in both the two counties respectively. However, interestingly, you'll find that in Vihiga, male involvement in activities and stimulation appeared to be more in Vihiga compared to Nyamira. The other aspect was the issue of involvement of caregivers in totality that came into play as some of the key factors. Thank you.
Thank you very much. I'll just add the next question before you get away, and don't go away, please, until we finish this panel. So among the 595 caregivers, especially the caregiver child dyads, from your study, what did the quantitative findings reveal of the level of father involvement in each county? From the 595 dyads, what was the quantitative findings revealing about level of father involvement in each county? Ambrose?
Yeah, from the study, Dr. Thank you. We realized that the quantitative data for Nyamira, there were two key aspects that we were able to look at, or rather that came out strongly. One is the issue of there were more male involvement in stimulation activities in Nyamira as compared to Vihiga. There were also issues of the issue of positive parenting by positive discipline by the male in Nyamira also was higher compared to that in Vihiga. There was also the issue while comparing male caregiver activities in terms of stimulation. You find that Vihiga had higher quantitative responses compared to that of Nyamira.
Okay, thank you very much. And I'll still come back to you, time allowing us, but I want to come back to Lynette as we continue in this conversation. And so you just helped us to see in terms of the burden of the women. But Lynette, if you can help us from the study, do you have any follow-up plans to focus on men's or fathers' involvement, especially in the caregiving, so that it can enhance positive outcomes for children? Just in 1 minute.
Yes, we definitely do. And given that it's a 3-year study and project, we are having some interventions that we're looking to incorporate. And so one of it is having a human-centered design approach where we're going to involve the community members because we're looking at sustainability, the long-term aspect of it. And so one aspect we're looking at is involving the community leaders and the religious leaders so that they can support us in enhancing or also amplifying the importance of, parental engagement for both men and women, and also having these interventions. We really want to involve the men themselves, the caregivers themselves, because they have a say. They're the ones who are taking care of these children. They're the ones who are involved, and they're the ones who are affected. So one of the interventions that we're looking at is co-designing these interventions with them, and also through the county governments that we are working with, both in Isiolo and Lamu. We want to be able to have like policies around unpaid care, and so that we can be able to amplify. And also, we are looking to have a change of attitude and beliefs. Thank you.
Thank you. And I just want to get a follow-up question on that, not necessarily in the follow-up with the men, but from your study, you talked about families that comprising more than 5 members. And maybe just to help us see, was it just the nuclear or is the extended? Whichever the case, and especially if it is in strengthening, looking at these large families in quotes, 5 and above, in the context of strengthening childcare systems, were there any negative implications, especially with larger households, or was it just benefit, especially in shared responsibility? Was that something you explored in your study?
Yes, it's definitely something we explored, and given that these communities are either nomadic or pastoralist, so you will expect, they will say it's a family of 5 or 12, they will say we are all brothers and sisters. However, the term they use for brothers and sisters, it's generalized. So we were not able to clearly stipulate that this is like the nuclear, but also because they have, polygamous, they're polygamous in some contexts. And so one thing that we really looked at is, given that they are 5 and above, it does not mean we're going to, remove them from the study. However, we saw it as kind of looking at it in a mindful way while designing these programs. So, yeah.
But I was just asking, did you find it as a negative that there are many, or was it positive that there was shared responsibility?
No, it was positive because now the burden is reduced, kind of. However, we are still in the process of conducting the study and also in the intervention phase. So we will be able to see that at the end line, if really it had a negative or a positive impact. But so far, it's positive.
Thank you. Thank you very much. Really appreciate that. And back to you, Mnuve, if we can just find out, I think you mentioned about the campaigns you did and just looking at the engagement across the country through the social media. What considerations have you made or conducted as a follow-up to assess actual outcomes, especially across the genders, the language groups, so that they can adopt the nurturing care practices? Thank you.
Thank you. At the moment, we are in the planning process in collaboration with our main partners, who is UNICEF, who has been with us since we started, almost all the documents, and other partners. We are in the process of establishing the ECD landscape in Kenya. We have been presenting ECD landscape in Kenya, but actually we have never had a study on that. But now we are in the process of having a paper. We do the stock take, and actually the process has started. Next week we will be developing the tools. So we want to ride on that process of stock take, so that we can have at least questions that can look at the impact of that campaign. In that way, we will be able to incorporate as part of our sample size the counties that we have disseminated, which were 6, and other counties. In that way, we will be able to know what changes occurred, even if it's minimal, and also we'll be able to look to other counties that we've not disseminated to see whether there is any disparity in terms and the impact as compared to each county. We're in the process. By the end of this year, we will have published the results of ECD landscape, and at the same time, we would have gotten that feedback of what actually impact it has caused the campaign.
Thank you. Thank you very much. Silas, in 1 minute, if you can just tell us from your study recommendations, what studies can be employed to enhance further involvement? And you gave us just in 1 minute.
Thank you. For strategies, number 1, I think let's define what we mean by men involvement. Let's not just come to meetings and start saying men are not involved, men are not involved. what do you mean by men involvement? What is it? Yeah, because if you look at the room here, there are more men than, but what is men involvement? Define that. Number two, if you want to hear about men, speak to men. Don't speak to women about men, asking them why is your husband not involved. Speak to men directly, and they will tell you why they are not involved. Number three, if you want to design interventions, and one of the things that we want to do is to synthesize and understand all. Thank you. I think the third one, if you want, and you want to do a synthesis to understand the impact of many interventions that are targeting men. One of the third thing that we need to do, Daktari, is to do men-only interventions in childcare. Let's not focus on women intervention and expecting men to come and participate in those interventions. They will not participate. Focus only, men-only interventions, and you will see the results of their involvement. Thank you.
Thank you very much. Makofi kwake. And I'm told our time is far much spent, and Prof, it seems I missed this. And maybe we'll interact with you to hear on that, because we need to bring this panel to a close. But thank you very much. As we move on into our next session, I think let's appreciate this panel for the great job done, and we'll interact with them more. We get to the next session. Thank you.
Hello. Hi. We're coming to the last leg before lunch. So I want to guide you to where you're going. We are having breakaway sessions right now till about 1:30. So breakaway room 1, itakuwa Chui. Chui ni kule juu. Sawa sawa. For what is happening in Chui, for those ones who would want to know, strengthening early childhood development systems, that is the conversation in Chui. The chair for that will be Harrison Kamau. So if that is your group, please head there. Kifaru is breakaway room 2. That is headed by Miss Amina Mwitu. Kifaru, again, is where we came from, that block. The discussions there will be from vulnerable to valuable, sustaining early childhood development initiatives. The conversation is headed by Miss Amina. Breakout room 3, ambayo itakuwa Nyati, again, the other end, Nyati inaongelelea from vulnerable to valuable, sustaining early child development initiatives. Conversations are headed by Adan Boya. So if you have papers for breakout room 3, Nyati is on the other side. And then Hapa Swara, which will be headed by the session chair, Linda Olo. The discussions will be around equity, diversity, and inclusivity in the implementation of nurturing care and leveraging digital ecosystem for early childhood development outcomes. That is what will happen here. As you go to your breakout rooms, I will personally be coming round to give you your meal cards. So kindly, usikose meal card. I'm the one who has them. I will also be there for you. So if you can use about 5 minutes to be able to begin, wale wa Kifaru washaanza, I will appreciate. Asanteni sana. Once again, as you leave the hall, breakaway room 1 ni Chui, breakaway room 2, Kifaru, breakaway room 3, Nyati, and breakaway room 4, ni Swara. Lunch will be at 1:30, so that should guide the time management that we have. Ama naona mumefurahi sana na Swara, mnaweza nipigia makofi tukai pamoja, or tunaweza simama tutembee pole pole. Wale wa Swara, Linda Olo, please come to the front. The rapporteur, Rachel McKenna, is in the room. Rachel, Miss Linda Olo, if you're here. Yes, she's here. Session chair for the room is here. All the other rooms are on the other block. As you walk up to the reception, take your left and you will be guided. Kifaru is on the ground floor, while Chui and Nyati iko upstairs. Time management. For people in this breakaway room, people in this room, we have Rehema, Monica, paper yako ya nurturing care approach for children with disability. We have Stephen Ikonya, Mario Mare. The Action Foundation should be here in this room. We have a case study from Uganda. Zekaria Ochan should be in this room. We have Keynote. Keynote should be in this room. Peter Obare, Cindy Akech, Emmanuel Oyer, Abella. Keynote should be here. We have the team from STEAM, Education in Early Years. Professor Gaki, Dr. James Ndege, Professor Stephen Runo, Kumar Ankur, Dr. Josephine Mutua. And for our participants online, we acknowledge you and we see you. Keep your questions coming in. And the session chairs, kindly be able to acknowledge the ones online as well and interact with them. Ms. Linda Karibu. Is this mine? Rachel McKenna and Miss Linda Olo, please take to the front. Miss Linda, kindly come to the front. Again, for our online participants, thank you so much for following. Share your questions via email, via the Zoom chat. Our session chairs, our moderators will be able to facilitate and be able to make sure that you are acknowledged and we are chatting with you. Makofi kwa Miss Linda as she comes on the stage. Makofi kwake. Moja, mbili, tatu. Bado mko na nguvu. Karibu. Asante.
Good afternoon, everyone. This one? This one? Okay. Good afternoon. Can you hear me? Oh, this one? Yes. Okay. Good afternoon, everyone. Welcome to this session. So this is the session on equity, diversity, and inclusion in the implementation of the nurturing care and leveraging digital ecosystems for early childhood development outcomes. I will be your session moderator. My name is Linda Olo, and I will be supported by the rapporteur. Please confirm if you are around. Okay. So in this session, we will be having a panel. The panel will consist of Rehema Achieng. Please confirm if you're around. So as Rehema comes, I'll just read her brief bio. So Rehema is a dedicated child and adolescent advocate with a bachelor's degree in education who currently volunteers at Keynote, Kenya, attached to the Smart Start Initiative project, which is in Siaya County. She coordinates high-level advocacy for nurturing care and disability inclusivity in ECD programs. Her background in leadership and education fuels her passion for ensuring inclusive early learning for all children. Karibu Rehema. Please give her a round of applause. Our next speaker will be Ochan Zekaria. Are you around? Ochan? Okay. Oh, are you Ochan? Okay. So I will skip Ochan for now. Our speaker, the third speaker, will be Peter Obare. Is Peter around? Okay. So Peter is a journalist by profession. He's a communication officer at Keynote, Kenya, with a bachelor's degree in communication and media technology with information technology. He has great passion for nurturing care for ECD, and for the past 7 years, he has been part of communication and advocacy efforts for child-focused initiatives, helping raise awareness of children's well-being and nurturing care interventions. He plays a key role in the Smart Start Siaya project, first in Siaya County, Kenya, and through notable successes, being scaled across the Lake Region Economic Bloc, overseeing visibility, stakeholder engagement, and the promotion of early childhood development. Please give him a round of applause. Next, we have Professor Catherine Gaki. Are you around, Prof? Okay. Oh, she's online. Okay. Okay. So I will read her bio, and I hope we'll be able to connect with her. Professor Catherine Gaki Murungi is an associate professor at the Department of Early Childhood and Special Needs Education at Kenyatta University, Kenya. She is an associate professor of early childhood studies with over 2 decades of experience in teaching, research, mentorship, and educational leadership. She is a distinguished scholar in ECD who has contributed extensively to research in child health and development, inclusive education, teacher, professional development, and the use of technology in early learning. And her scholarly work has been featured in prominent global policy publications, which include the Disease Control Priorities and English for Child Development. She has co-authored numerous empirical studies and is a recognized leader in curriculum innovation. She introduced a pioneering course on artificial intelligence in early childhood education, which is set to be incorporated into the department, offerings upon completion of the review. She continues to champion forward-thinking proposals such as robotics and digital citizenships in ECD. Although these were not approved in the last departmental review cycle, they represent transformative, future-ready approaches whose relevance in today's dynamic educational landscape is increasingly evident. She also has a strong track record of institutional collaboration, including a sustained partnership with Child Fund Kenya. Please give her a round of applause. Next, we have Evelyn Ngare. Evelyn is the Director of Fundraising and Partnerships at the Action Foundation. Is she around, Evelyn? Okay. Yeah, so in this role, she leads the fundraising and partnership strategy for the organization by driving resource mobilization efforts, cultivating transformative partnerships, and securing sustainable funding to scale inclusive programs across Kenya. She is a strong advocate for equity and inclusion and is deeply committed to unlocking opportunities for marginalized communities, especially those with disabilities, through strategic partnerships, innovation, and meaningful engagement. Please give a round of applause. We should also have Pauline Masese. Is Pauline around? Online. Okay. Pauline, I hope you can hear us. I did not get that, but I hope Pauline can hear us. So Pauline is a development professional with expertise in ECD, project coordination, gender advocacy, and youth leadership, and is committed to empowering adolescent young learners and advancing inclusive solutions in Kenyan communities. She serves as the project officer for the Adolescent Girls Movement and county coordinator for Imarisha Msichana project at Forum for African Women Educationists, Kenya chapter, Fawe, Kenya. Her work focuses on advancing young learners and girls' education and leadership opportunities from early childhood through adolescence, and her work in ECD emphasizes natural care, school readiness, and the integration of play-based learning in emergencies and undeserved settings. By challenging harmful social norms, promoting community awareness, and advocating for policy change, she is helping to build more inclusive, equitable communities that safeguard the rights and well-being of children, adolescents, and youth. Please give her a round of applause. Finally, is Steve Ikonya around? So I think that is the panel that we have for this session. If there's anyone else who is left out, please let us know, because we had 2 panels that were merged, and I think some people may feel that they've been left out. But for now, I will give our panelists 2 minutes each to tell us, to give us briefly a brief background of their projects and what the key highlights were in terms of the findings. So I'll start with the online people, then we can go to the virtual participants. Thank you.
Thank you so much. And gratitude to the ECD network for creating a platform where key stakeholders can come and discuss issues affecting children. On a nurturing care framework for children with disability, while we all know that that children, the normal children, require nurturing care, we are aware that children with disability require more intensive strategies to care for them. And we know that brain development is very important between the ages of 0 to 3, the first 1,000 days. And the World Health Organization provided the nurturing care framework to address, as a pathway to address developmental issues and to also unlock, to ensure that children have a conducive environment where they can thrive and survive. The nurturing care framework also gives a stable environment where kids are able to access good nutrition, good health, adequate nutrition, safety and security, opportunities to early learning, and responsive caregiving. And when we talk about children with special needs and disabilities, we are not only talking about those with neurodivergent issues, that is those with autism, cerebral palsy. We are also looking at children who are with incarcerated mothers, those in the prison systems, because we know that the prison environment does not allow these kids to really access care like those at home. And we also look at those in institutionalized care because the environment, they also face stigma. And when looking now at the nurturing care framework aspect with children with disabilities, good health will allow when the caregivers or the mothers are pregnant, when they go to the, let me wind up, thank you. When they go to the hospitals early, when they access these services early, they can be guided to ensure that they are able to track the developmental milestones of the children. When you talk about adequate nutrition, they can be given specified nutrition intervention, supplements that can handle issues like malnutrition and other nutrition issues. When you talk about opportunities to early learning, when these kids have already, when they are disabled or issues, they can be provided with interventions like play-based therapy and other issues around education. And safety and security is just ensuring that as much as these kids are disabled or have delayed milestones, they're able to be in a safe environment where they're able to thrive and survive. Thank you.
Good afternoon. Sorry, it seems I've donated 1 minute to her. Mine will be a bit brief. So my topic was on data and technology for strengthening evidence and accelerating action in nurturing care interventions. So generally, I was trying to look in a situation where our interventions have to be data-led so that when we make considerate actions, we have to show evidence. And this will revolve around accurate data, and also which will be harnessed in the use of technology. But generally, as we see on our rural and marginalized areas, there's so many gaps on inclusivity, marginalization, and also some cultural situations that make this data not available, but yet we need this data much to do much planning for these children. Thank you.
So we can link up with our online panelists. I will call upon Pauline Masese, can you hear us?
Hello? Hi.
Hi, Pauline.
Can you hear me?
Yes, we can hear you. Please confirm if you can hear us.
Yes, I can.
Yeah, so thank you for joining us. And we are just starting our preliminary phase of this discussion, and we want to hear what you have to say. If you have a project that you are implementing or a programmatic work in the context of equity, diversity, and inclusivity in the implementation of the Nurturing Care Framework. So we would want you to give us key highlights of your work and the key outcomes or key results that you found out. Thank you.
Thank you. So as you said, my name is Pauline and I work for Fawe Kenya. And we have been implementing some components of a project where we include, my topic was about leveraging digital outcomes for early childhood development. When we talk about how we are using the digital systems, digital platforms to create content tailored for young learners so that we can localized content tailored for young learners, improve or rather advocate for teacher building their capacities, and parental engagement and enabling infrastructures that enriches learning through play, exploration, and self-digital navigation. So we found that when to playful ways of learning, so our platform talks about having such content developed like videos, animations to enable the young learners to grasp whatever that they've been taught. Thank you.
Thank you, Pauline. Sorry, I gather that you are in the theme of leveraging digital ecosystems for ECD outcomes, so thank you for that. We will give it to Professor Catherine Gaki, who is also online, under the theme of equity, diversity, and inclusivity in implementation of Nurturing Care Framework. Kindly give us the key highlights of your work or your key thoughts on this theme. And if there's work that you are doing, you could please give us the global results of your work in 2 minutes. Thank you.
Thank you so much. We looked at the conceptual foundations of STEAM. And when I talk about STEAM, I'm referring to science, technology, engineering, arts, and mathematics, in line with education in early childhood. We explored the opportunities and barriers to integrating STEAM education in Kenya's early learning system. We looked at the curriculum and policy innovations for interdisciplinary, child-centered learning. And lastly, we have a framework that supports the 21st century skills in creativity, in collaboration, and in thinking from early years. As I present this, I hope this audience, someone seated in this audience, we hope that we can get someone to support this project that we hope to implement. It's ready. We are only waiting for someone to fund us, a well-wisher, so that we can cover the budgets and we start implementation at KU. Details of this are available to any interested party that would want to partner with us in this particular project. And you can side chat me. The details can be found from ECD network, and also you can get my email address from the abstracts that have been shared. So I interacted and attended many webinars hosted by Ms. Kim from South Africa on the importance of STEAM education in ECD, and this sparked an interest in me and the team, and we knew something needed to be done in Kenya. Many Western countries already have effected STEAM education in their early learning. So for us, we want to establish what will work for us in Kenya. And I reviewed literature that is less than 5 years old. So we looked at literatures available from the years 2020 to 2024. We focused on STEAM in early childhood education, like I've said. We looked at policy analysis. We reviewed the CBC 2017. We reviewed the competency-based education And also we reviewed the CBET, Competency-Based Education and Training Framework for 2018. Then we also looked at the Vision 2030 for Kenya. We looked at Continental Education Strategy for Africa. That is for the year 2016 and closing now in 2025, the first 10 years plan. And currently, we've also looked at the one that is being reviewed now, the work in progress for 2026-2035, CESA Strategy for Africa. Then we also looked at the strategies, though under development based on continental consultations. Lessons we drawn from the case studies in Kenya. We also drew lessons from case studies in Rwanda and also case studies in Singapore. And now the other reflections through insights and curriculum development and teacher training in Kenya. So the tools that we used were thematic synthesis, cross-context analysis of enablers and barriers. Our key findings, we found out that creativity and curiosity is fostered through STEAM, whereby children explore where they imagine, and also it encourages problem solving among children and critical thinking by inquiry and iteration. We also noted that STEAM education promotes collaboration through group task and peer interaction. We also found out that real-world relevance and inclusion is possible when STEAM curriculum is incorporated in the normal learning curriculum, connecting classroom learning to home and community contexts. We also noted that it supports gender inclusion by challenging early stereotypes through diverse role models. And lastly, but not the least, it aligns with global and national policy goals, that is strategic development goals number 4.2 and Vision 2030 and CESA 2026 to 2035, that is work in progress. What are some of the lessons that we've learned as we reviewed and interacted with workshops and seminars on STEAM education? We are able to confirm that constructivist interdisciplinary approaches are ideal for early years. STEAM access must be inclusive across rural and urban areas, and also lack of assessment reforms limits recognition of creativity and problem solving in early grades. What do we recommend? We recommend that there is need to develop STEAM curriculum, guides, and model lessons aligned with CBC. There is need to train teachers through modular pre- and in-service programs like TPD programs offered in universities, KU included. We recommend investing in low-cost, scalable STEAM tools like marker spaces and local manipulatives. We recommend reform assessments to reflect on creativity and innovation that matches the 21st century where we are in right now.
Yeah, summarize.
We
Prof.
recommend establishing a national STEAM task force and also promote partnerships, public and private, to expand access and reach. Thank you very much.
Thank you, Prof.
Over to you.
Thanks. So finally, we have Evelyn. Thank you for joining us. So maybe you could tell us how equity, diversity, and inclusivity sits within the work that you do at the Action Foundation in very, very brief 2 to 3 minutes. Thank you.
All right, I have 2 to 3 minutes. My name is Evelyn Ngare. I work with the Action Foundation. I'm the Director, Development and Partnerships. And so I had a presentation, but I've been given 2 to 3 minutes. I know. In brief, the Action Foundation has been working in Kenya for over 15 years. And the past 5 years, we realized there's a lot more work we can do when we are working with the government. Yes, we were working with the government, but not really going and opening centers. I know someone is wondering, what does the Action Foundation do? We work with children and young people with disabilities in all spaces, health, education, and all of them, because they're all cross-cutting. There's no time you'll drop the ball for a child with disability. If it's education, you have to support. If it's health, you have to support. So we have centers, currently 4 main centers in Nairobi, therapy centers in the inner cities. We're talking about the Kibera, the Mathare, Dagoretti, and Mukuru. So we have centers where we do where we do therapy work, speech therapy and physical therapy. We know there are 5 therapies that a child with disabilities is given. However, for the sake of this conversation, over the past 5 years, we've started working with the county governments. In fact, county governments, some of them came and saw the work we've done with Nairobi County, and we had a good MOU with Nairobi County government, where we were now training the teachers in Nairobi County to, first of all, be able to identify and assess children in their class who have, for example, low vision. I had that question earlier on, but how can a teacher assess a child who has disability? So just really basically assessing that this child has low vision, hence they can't read. It's not that they cannot read. Another one is, for example, a slow learner, how do we support them? I'm actually not able to support them, or I'm not trained, I don't have the tools to support them, but I can assess and know that this child requires more support than what I can do. So that's what we were doing with Nairobi County, and just training the trainers in the schools to be able to identify that. So Kajiado County also came on board, and we started working with them in partnerships with various partners like the Benjamin Foundation and the World Guns, and among others. So what we are doing there is just training the trainers. I know I have maybe a minute, but training their trainers to also identify that. Identify and assess a child who requires more support, from the teacher, that the teacher cannot offer or the school cannot offer, and really go to the person who can support the EACs, the Action Foundations, Ministry of Health, and people who can actually support. So just going over and beyond the centers that we have, the therapy centers, but going out and supporting the county government for their trainers to be able to know how to support all learners, because we are talking about dignity, we're talking about accessibility, we're talking about leaving nobody behind. Just because a child has a disability, they should not be left out of the education system. So we will have to do all that together, education, health, and all ministries. I'll wrap it up like that. Thank you. Yeah.
So, I think I'll ask our panelists who are physically present here, just quickly, so that we do another round of discussions, but very briefly. Now, we have talked about disabilities, we have talked about children or persons in arid and semi-arid areas. Now, looking at the policy outlook, the policy lens, how do we ensure that we have diversity, equity, and inclusion in the policy discussions? And secondly, maybe we could just take two questions at a go very briefly. How do we ensure that we leverage digital technology to harness inclusivity in the work that we do? Thanks. So I'll start with you. Yeah, we can just do a round.
Okay, so I'll say at the Action Foundation, currently, as you see, we are working with these counties, and we are coming to the FCDC. So what we say is we are seeking collaboration. We are really open-hearted, and we're seeking collaboration to strengthen, number one, the teacher capacity of exactly what I've talked about. Number two, the school leaders. It just doesn't stop with the teacher, because a teacher can report a student probably has eyesight issues, and the school leadership does not, So just the school leadership as well, the parents, the caregivers, to build that teacher capacity and implement the training and all that together with them. So we are seeking that collaboration from all actors. Secondly, advocacy for policy changes that are addressing the data poverty. So in the disability space, when you try and check, there's literally a big data poverty. There's no data. So we are seeking that kind of support as well from our data, we call them duty bearers, but from our government. So we are really seeking that support, and so to enhance effectiveness in the decisions we are making, so that we are not just coming up with decisions that are not backed up by data. Last but not least, we are seeking to leverage on what we've already built. So could you step onto our shoulders and so that your shoulder above the rest. You don't have to repeat what we've been through the last 15 years. Leverage on some platforms that we've come up with. For example, digital platforms, I'll talk about the ones that young people are able to use to learn and thrive. So how can we leverage on what we've used technology-wise? Reaching the children with disabilities, training models. How do you use what all these NGOs and all that are able to do? Then last but not least, invest in infrastructure. So how do we invest in infrastructure in the special and integrated schools? I don't know, I'll ask a question in the delegates, who has gone to an integrated school and found that it has good infrastructure? So can we invest? I know there's infrastructure, but you know what I'm talking about. They're a bit left behind. Let's purposely consider them as part of our community and invest in the infrastructure mechanisms, and we'll see all of us thrive. Thanks.
Yes, thank you. Okay, so as I alluded, and as my fellow panelists has alluded, is that we need data to make every child get involved and get a potential development. So generally, we realize that to do this, we have to have the inclusivity and have technology that can be culturally sensitive. Yeah. So generally, for my first point, I talked about culturally responsive design, where I noted that digital ecosystem should reflect local traditions, languages, and caregiving practices to ensure relevance and acceptance. And also, we also use these systems that are already aligned in the community, where we engage people like the caregivers, community health providers, local leaders, so that as we design these platforms or the technology that we are to use, then they get involved, and so then the content will reflect their local languages and also customs and the values. So also, as we work in the marginalized areas or the underserved, we have to talk about the equitable access of these scenarios. So for example, the tools must be designed for low resource settings with offline capabilities. Like in my village, sometimes there are places you can't get the internet or some connection. So we have to include the offline scenarios for these people, and also include the features. Maybe we tailor-make the digital tools so that we can reach people like in the rural families, the teen mothers, and those who are misplaced because of the floods and any other calamities around. So generally, we can talk about technology as a powerful tool, but then to ensure that no child and caregiver is left out, we'll ensure that there is inclusivity, equity, and cultural sensitivity as well. Thank you.
Thank you so much. Both Obare and Evelyn have really given great insights. And just to add on it, I'll say that we will need community integration. For success, we'll need blending of digital tools with the existing structures, because there are certain cultural structures that are happening in the community, in the schools, and to ensure that we have trust, reach, and sustainability of the same, you have to speak their language. As much as we are adopting digitalization, you have to really integrate their aspect in order to speak to their hearts. Thank you.
Thank you. So to our online team, I don't know whether Pauline is still with us, Masese. Pauline?
Yes, I'm here.
Yeah, so we are just winding up the discussion, and we wanted to hear what you have to say in terms of how we can harness digital opportunities to ensure that we do not leave anyone behind. What are your thoughts about that? Thank you.
Okay. So my thoughts on that is, number one, we need to recognize that we are living in a digital era where everything now is moving to that particular point where even young children are adopting, or rather are engaging with each other digitally. So as national and county stakeholders, we need to recognize that digital inclusion is as a right and a foundational component of early learning. Thus, we will, as my colleagues have said, we will be able to invest in infrastructure and proper content to be able to nurture their curiosity, creativity, and critical thinking from a very early age. Number two, what we can do is continue with ongoing monitoring and research and data collection to be able to inform the adjustments in matters of in terms of policy adjustments, as well as provide evidence-based implementation. I think those are the major things that we can do. Number three, we'll always look for partners. Whenever we have, we strengthen partnerships with other people so that we can be able to have affordable and innovative solutions that can reach even the undeserved, or rather the marginalized areas and communities, so that they can also feel included as the nation takes up, young people take up these digital solutions to be able to nurture their curiosity and creativity. Thank you.
Thank you so much, Masese. And finally, to Professor Catherine Gaki, I hope you're still with us.
Yes, thank you.
Yeah, so you can please tell us how we can harness digital opportunities in STEAM around ECD work. Thank you.
Thank you so much. I remember yesterday during the presentations, we heard that there are children who sit on the floor while in classes. We also heard that there are schools with tablets, but with no power connectivity. And we also heard that in Garissa County, there are children who attend school for 2 days in a week. So allow me to speak into policy integration, even as we talk about embracing STEAM education. There is need to embed digital interventions into county integrated development plans, as well as the national ECD strategies and ICT in education frameworks, and then follow them through to see that they are actually implemented. Two, we need to ensure that there is funding allocation to support digital access in ASO and informal urban areas. And as we become digitized, we need to protect child data and privacy in line with Kenya's Data Protection Act of 2019. Since cultures are also different, we may not have a one size that fits all, but we can establish national guidelines for culturally and developmentally appropriate digital content that is approved by various communities. Ensure representation by including all actors, include marginalized communities, include disability rights group, include ECD experts, include the academia, and the digital policy makers. And lastly, set up multi-sectorial task forces, such as ICT, where health sector is included, directors of county education are included, and social protection personnel. Do not leave out the child services, the prison sector, because we have children in prisons, for the incarcerated mothers. We need to also work with First Ladies Caucus, and the list is endless. We need everyone on board for the sake of the child. Thank you very much, and it was nice speaking in this particular conference. Asante.
Asante sana. So at this point, I want to close this discussion, and I want to thank you for the opportunity to moderate, and I think we look forward to more interaction. Thank you so much to the panel for your contributions. Thank you. Oh, okay. Okay, so I'm advised that we can take some questions from the audience in the spirit of leaving no one behind. Sorry, I was leaving people behind, and I'm here talking about equity. Apologies.
Yeah, thank you. This is Mr. Boru from Marsabit County. We are learning that there's research conducted on harnessing digital technology to promote ECD learning. So I beg to seek to know what is the balance between the digital learning and print learning? Do we need to shift holistically to digital learning because we are in 21st century, or we need to balance between the digital technology of digital education and print media learning? Because I believe when a learner is involved in, tactile learning, maybe writing or forming a letter using a pencil, that will or writing notes, that will promote more comprehension, more learning, as opposed to screen. I stand guided. Please, what is the balance between the two domains of learning? Thank you.
Thank you. We can take a second question. Then, Then we can get.
Thank you very much for the presentations. My name is Margaret Makelo. I'm the First Lady, Bungoma County. As I said, I came here to learn and see how I can move forward with this ECD system. Today we have had presentations, and especially those sharing the studies that they have undertaken. And what left me a bit wondering, because I need to be guided, is why are we referring to mothers and fathers as caregivers when we are giving results to the outcome of our studies? Because you can't refer to me as the caregiver of my child. Tell everyone that I'm the mother, I am the father, I'm the guardian, I'm a relative. And remember, we also have house helps whom maybe we don't pay or we pay something. We have children in prison, and we have children's homes. Nobody has talked about those guys. So I think it will be fair if we separated the caregiver results so that we know whom we are targeting depending on where our children are. And the other thing I also wanted to provoke maybe some other studies is, let's look at these children's homes. I'm saying this because one of the years I took Kandui Children's Home to be my Valentine. And I went and set up a toy room for the one, not there you even get out, the 1 day old. And by the time I was leaving that afternoon, 4 or 5 of the children clung on my leg because they want to go with me. And unfortunately, I was so traumatized, I've never gone back there because I didn't have a solution. But now I have, because there's something I can do if we hold each other's hand. So thank you for the presenters. I've learned a lot. And I believe that in the next ECD network conference, I'll be also presenting my results of what has come out of what I will be doing. Thank you.
Hi.
Okay, so I'm advised that we can take those 2 and then we can have 2 more. So who will take the first question? We also have our online panelists.
All right, so I'll allude to the 2 of them a little bit. We cannot do away with tactile. Tactile, there's something around motor skills. So there are several skills a child must learn, but we cannot hide under the sand that the future is digital. It's very, very digital, and we have to equip our children wholesomely. We talk about, being local but thinking global. So when you're thinking about workspace, entrepreneurship, you're thinking about employability. I think 10, 15, 20 years from now, we're talking about AI right now. It's here with us. So let's really get into the space and equip our children. I'll give you one statistic. Only 9.6% of children with disabilities aged between 3 and 17 years were attending school for the work that we were doing. Looking at the ones without disabilities, 90% were attending school. So only 10% were not. So when you're looking at even just putting aside these children with disabilities, they're at home, they're not even getting the tactile, they're not even getting the digital. I mean, what's a future? Let's prepare our children for the digital world, but let's not, assume that they do not need the tactile. They need the human social skills. All right. First Lady, thank you for your sentiments. I know. But when you talk about us as the Action Foundation, when you talk about the caregiver, we are talking about all the other people that are not the parent. All right? So, for example, I stand corrected, but as the Action Foundation, the teacher is a caregiver. In my absence, that teacher literally is taking care of my child. Or even in the ECD centers, the person who's taking care, a nanny is a caregiver. Sister, somebody who's just taking care of the baby. And sometimes we mix the caregiver and the parent just to make the data, more explicit. But I love what you just said, and we'll put that into advisement even in the work that we do. But I hope that is a bit more clear from our end. Maybe he can add.
Thank you. Obare, please.
Okay. So generally, for me, I can say technology is just inevitable at this era. But then we just have to include everyone in it, because as well as we embrace technology, we must be sure of online abuse as well. So there's a way that it must be controlled, and there's a way that we can include all sectors to ensure that this is a continuous improvement, so that wherever there's a hitch, it is done and all the marginalized are reached. So generally, we must embrace the technology, but does not mean that we leave our previous print ones.
Thank you. So I get it that we must use both approaches when it comes to technology. And I think we need to disaggregate our data better so that we stop generalizing when it comes to who is a caregiver. Other people say primary caregiver, secondary caregiver, but if we are able to disaggregate, then we can be able to know who really takes care of children. Thank you so much, First Lady, for that. 2 more questions, then we wind it up. Yes.
Can I respond?
One here and one here. Yes, please, you can respond briefly.
I wanted to respond to the question on whether we need to go fully digital learning or we can just incorporate digital technologies. And my response to that is that the real balance is pedagogy-led and not technology-led. So let's start with pedagogy. What are the learner needs? What outcomes are we targeting? Then select the technologies. Choose tools that support those outcomes, not the other way around. So for us in Kenya, I cannot say right now, like for early years learning, we are ready to go fully digital learning, but we can have a balanced integration whereby we have blended learning, combining in person and also some digital activities like we are currently doing it at the CBC. And we can also use technology to enhance, but not to replace human interaction like my fellow panelists have indicated. And we can also ensure accessibility, training for teachers, and also assessment for effectiveness using technology. So there are good things that we can borrow and include in our day-to-day school learning activities that can enhance our performance as teachers and even the way the children learn. Thank you.
Thank you, Professor. So, yes, Paul, and one more on this end.
Yeah, thank you. Thank you, our panelists. My name is Paul Otwate. I work with African Population and Health Research Center. I'm curious, what I wanted to ask has been already responded by Prof. But the second thing, I'm very curious to understand if there is any framework that we are actually anchoring this particular intervention on use of digital ecosystems. Then the last one is about, you have mentioned about leaving no one behind. What are the plans about supporting we are really focusing on the child with disability. What about the parent of this particular child? What are the plans that we have, especially on the support needs? And most importantly, where we are currently, we have a lot of climate impacts, children that are affected by climate changes. What are we doing in terms of bringing technology to become one of the intervention for this? Thank you.
Thank you, Paul. I hope you took. Okay, one more.
Thank you. I'm Mahfoud Abdullahi, Chief Officer ICT and E-Governance. I'd like to pass my question to the panelists and the honorable panelists. and it's on the issue of AI. What's the place of early childhood in AI? Because we've moved from the digital age into the AI age. There's a lot of things you can leverage on AI, especially on issues of personalized learning and specialized needs. And I think we've not moved. And what are the ethical implications we should look at as we're moving to that? Because as the world is moving, we'll always get ourselves there. A good example is, I'd also like to mention, is statistics in one of the subscribers' YouTube channel. It's Cocomelon. It's one of the early learning. In as much as we know, but most parents use it. Currently, as at 2025, the subscribership in Cocomelon stands at 195 million. That's a huge number. That's where learning starts at home. What are the effects to the kids? Because you find that parents turn it on and leave it to the kids. What studies have been done against that?
Thank you. Okay, finally, last of last.
Yeah. Thank you very much. And it's always very good to hear all the good research that is being done in special needs education. My question is to the Action Foundation, Eva. Yeah. You talked about capacity building of trainers, the TOTs, which is very, very significant when it comes to making sure that they deliver. Because then the issue of capacity is what is lacking in many of our institutions where our learners with special needs are. So my question is, how do you determine the content that is included in that capacity building initiatives that you have? Because there's so much that can be taught from A to Z. So how do you narrow down to say that this is the content that is relevant for the context that you find yourselves? But most importantly, how do you measure the impact of that training to make sure that you're achieving what you intended to achieve? Because it's one thing to train, another thing to determine that the outcomes of that training are really being realized in those contexts where we are. So what determines the content and then the impact? Thank you so much.
Thank you. So our online team, I hope you are with us. So we can split the questions so that you can take some, and then we can give Professor Masese to take some. Okay, so yeah.
Thank you so much, Otweche. I hope I got the name right. I would like to respond on the plans and support for caregivers. We know that the burden of having a kid with special needs and disability lies with the mother, because first the stigma begins with your partner. Imagine umeshika mimba, umebeba miezi 9, umezaa mtoto ambaye ako na disability. Yesterday we had conversations around disability, and we had one of the speakers saying that wanaume wananzia hapo. Unaanza kuambiwa hiyo ni laana ya kwenu. See, that happens. Up from the partner, it goes to the society, because there's a way the society has made a system of how things should happen. Inafaa mtu anashika mimba anazaa mtoto mwenye yuko sawa. So the burden is there, and we really encourage and really champion for caregiver support. We need to strengthen structures that really take care of the psychosocial support of mothers and caregivers. Yeah, thank you. I'll allow Evelyn answer that.
All right. I'll also speak to that in the afternoon at 2:55, but I don't know if the times will still be the same. I have another presentation around an elaborate care model that we've been working with our caregivers. So, of course, as she said, they face a lot of stress. They face a lot of stigma from home and from externally, and isolation. You're on your own, in your own world. Day and night, they have no rest. So I'll talk a lot more about the care model that we're working to support them. First, as a caregiver, there are many studies that say if there's positive parenting, then there's stimulation in terms of how the child grows, even if they have disabilities, and how, the results will be as time goes by. Because, some disabilities can actually be, supported in for example, speech therapy and some physical. So it depends with how the caregiver is. So I'll talk more about that in the afternoon. About I know we all love pedagogy, yeah? But on that, I want to say that we are not working in a silo. So we are working a lot with the ministry.
We are working with the ministry. We are part of so many, okay, let me not say so many, but we are part of communities of practices. We are part of, we are working with DSNE, and we, whatever content that we're sharing, even if it's from global spaces, we work with the government that is, to customize to the levels that our country or our local context is. I'll give an example. For digital, we're using, I don't know if it's a tool, technology called Scratch. Scratch is a visual fun kind of technology to support learners with disabilities or just young learners, children and beginners, the ones who are very young, early stage, to have fun and be exposed to STEM-related and digital-related courses. So even with that, we still work with the ministry to see how do we then integrate that in our schools, especially like what we've done in Kajiado and in Nairobi County. So we really work in collaboration, yeah, and have them approve it before we start sharing with our trainers.
Yeah, so I think we also had a question on caregivers with disabilities. I'm not sure if we've captured that. We have, eh? I thought we were talking of children with disabilities. Okay. And then on AI, the place of AI, I think that captures that. And M&E mechanisms, I think that was also raised. If you have any, or you're working on that, or maybe it's a lesson that we can take forward. Yeah.
Can I contribute?
Yes, please, Prof. Briefly.
Thank you. There was a question that was raised by Otiato on why we are focusing on children. Are we leaving the teachers and everyone else behind? Someone else was asking about climate change and how it's affecting early childhood. We have a paper on that. I think it's supposed to be later in the day. And also we have a paper on AI, so those that were interested, please come in and learn what we will be presenting, the findings from our studies. But then we are not leaving anyone behind where digital learning is concerned. And we are not only focusing on the child, we are focusing on the teachers, we are focusing on the child. And also in CBC, when children go home with homework, they go to parents and they go to caregivers who also assist them. So I want to respond to this with an analogy or a metaphor by saying digital learning is the journey. Learning technologies are the vehicle. The balance is ensuring the vehicle supports the right path that we want to take with the children, with the teachers, with the parents, with the caregivers, and that it doesn't exclude the travelers who will be along the way, the community, the researchers, and everyone else, all the sectors that are connected to the child, and is able to adapt to the terrain. And I think that would be my punching line. Thank you so much.
Thank you.
Please I'd also like to add something on the AI.
Yes, Pauline.
There was one speaker who talked about how we expose our children to cocomelon and the likes of it. So AI has negative effects. We all know that. We can expose our children to trafficking, exploitation. We are reducing human interaction. There is no that crucial emotional and social development when we're exposing our children to AI-related content. There are harmful stereotypes. There is digital inequity because a child who is in a rural setup or a low-income setup may be left out from not accessing AI platforms. But then what can we do? Number one, we need to realize that when we're using AI, we're using it as a tool, not a replacement for human teaching. So that's one key thing that as young parents, we need to realize that AI or content related to, increasing, nurturing curiosity and creativity and critical thinking in children should not be a replacement for human learning. It should just be a tool for to be able to increase a young child or a young learner's brain development. So we promote blending learning. Number two, we invest in children designing and reviewing the tools that are meant for them.
Yes,
so
Pauline,
we
please,
need
please
to
summarize. We are out of time.
Yes.
Yeah.
Sorry, the same way we are encouraging young people to always be at the table to create their own policies, the same way that we need to ensure that young people, children should also be at the table to look at what is best for them, so that they can be able to guide us to be able to create and develop things that are worthful for them. Thank you.
Thank you so much. I think that wraps it up. We are out of time, but apologies, it was worth it. So thank you, our panelists, and thank
shots.
you. Yes.
We have parting shots.
Oh.
Just to summarize.
Yeah, we are really out of time, so half a second.
Half a second. I would say that supporting children with disabilities and mental health of caregivers is sides of the same coin. We cannot achieve one without the other. Thank you.
Thank you.
So for me, on technology, I can say that we can introduce digital programs to everyone, and this means a multi-sectoral approach. And this is why Kemet is coming in to involve everyone, and also the county, to have this as a county-led program, so that this becomes a sustainable program in any time ever. Thank you.
Finally.
Finally, I just said this in the other panel, but the future is very digital. Let's embrace it, but be very careful. The safeguarding measures, let's be there. And let's not leave behind the children with disabilities and assume that they do not know how to use technology, yet we have not exposed them to technology. But the future is very digital, employability and the rest. So let's be part of it, raise our children to be very globally competitive. Thank you.
Thank you so much. Okay, a round of applause to us as we walk out. I think we can go for lunch. Thank you so much.
Across every culture, every continent, and every language spoken, there is one silent universal truth. The critical role of early childhood development.
My name is Professor Teresa Mwoma. I'm an associate professor at Kenyatta University in the Department of Early Childhood and Special Needs Education. I'm also the National Coordinator ECD Network for Kenya, which is a membership organization that was established in 2015 and registered in 2019. The network, the secretariat of the network is hosted by Kenyatta University in the Department of Early Childhood. The network is managed by a board of 9 directors. And as a network, we are a membership organization, and currently we have 105 members. That is 86 individuals and 19 organizations. We have 3 focus areas, that is advocacy, research, partnership, and collaboration.
So early childhood development is basically a period first, and then we talk about it as an outcome and as a process. A period ranging from conception to 8 years. A process that involves different actors coming together to plan jointly to deliver services for a child, implement by sector, and then monitor jointly how they're implementing and therefore adjust their program.
It's not just about the child, it's about all of us. Because when we invest in the beginning, we change the whole story.
The human brain here is formed in the first 1,000 days. So if you do not invest in the first 1,000 days for the human brain to develop effectively, that child will not achieve their potential. So basically, their ability, for example, to enter school, to learn, understand, analyze issues. If you don't invest in those early years, you have sort of lost a very critical window.
In the heart of Garissa County, where resilience meets hope, a quiet transformation is taking place. A movement grounded in nurturing care, driven by multi-sectoral collaboration and centered on the future of every child. Early childhood development is not a single program. It's a coordinated effort across sectors and systems rooted in the communities where children grow.
I would like to congratulate the ECD Network for Kenya, together with partnership with the government of Kenya and especially the county government of Garissa for this national ECD conference that has been held since 2018. And thank you for the opportunity to bring everyone together to discuss this important topic on early childhood development.
We need to recognize that the conference is not just a convening of practitioners, stakeholders, policymakers, and so on. It's an opportunity to bring to the fore issues around child development.
As advocates of young children, we should be where children are. And Garissa is one of the FCDC counties where children are. So let us go there, experience, and also support and learn from the Garissa people how they are managing, especially this is a pastoralist community. How do they manage? What challenges are they experiencing? What measures have they put in place to ensure that the challenges are being mitigated, because we want all Kenyan children to receive the best start in life without leaving anyone behind.
It is critical that as FCDC counties, we have formed the Sector Forum for Education, which looks basically at the ECD, which brings together the County Executive Committee members of education in all the 10 counties, the chief officers of all the 10 counties, as well as the technical directors for ECD of the 10 counties. So that is how ECD dovetails into the FCDC network.
Governments are responsible for delivering services, and in Kenya, the government is both national and county governments. So the most important strategy is to enable the counties to deliver ECD services. And for counties to deliver the services like health, education, water, sanitation, child protection, the county governments have a public budget. So what UNICEF does is it engages the county governments on those public budgets to ensure that they are prioritizing the needs of early years of children.
We have schools, ECD centers. We have 376 centers that are domiciled in primary schools in Garissa County. We have also 70 stand-alone ECD centers that are at the community level. Of course, they have teachers who are trained and who are teaching those students in those particular centers. We have around 25,000 ECD learners in those centers within the county. Initially, we had 176 teachers. We have employed 203 teachers recently who have been deployed in different centers within the county. So they are in the sub-counties spread across the county.
As UNICEF, we believe in sectoral coordination. We acknowledge that not one ministry, not one department can be able to deliver quality early childhood development services without coordination. And that is why at UNICEF, we have an ECD task force whereby we come together from the different sections to be able to address, as I say, the components of early childhood development.
Garissa County is leading the way with locally rooted solutions tailored to its unique needs. At Yadri Primary School, innovation grows from the ground up. Here, a unique kitchen garden stands as a living classroom and a lifeline. Lovingly nurtured by teachers and learners alike, the garden supports the school's feeding program, ensuring that every child receives a nutritious meal powered not just by food, but by purpose.
These vegetables, they assist our learners and even the teachers in school here. They get these vegetables because they are good in their health. Apart from the learners, these vegetables also, they assist even the community around. They help the community members around our school. They also get the vegetables from here.
The future plans that we have for ECD as a sector is one, increase the funding for ECDE because we need to invest in ECD. Once you invest in ECD, you have invested in that particular child and you have holistically developed the future of that particular child. Our future also plan is to advocate for integration of Islamic studies in the ECD curriculum.
As a country, we have given a chance to all our children to participate on all the issues affecting them. They have a slogan, they say, you can't talk about us without us. So we involve them in making decisions affecting them so that they give their views. And we have champions who do that work properly when it comes to issue of participation. We work in collaboration with the civil societies, that's state and non-state actors, so that we make sure that this pillar is properly achieved in our country.
We must be very cautious on how we plan for our children. We must make sure that investing in our children is not only investing in them, but it is investing in ourselves. We should all remember that an investment in that space of our children is an investment for the health and the development of all of us, from home to community and to a nation.
We are aware that now we have a national ECD policy and we are looking forward to it being implemented so that all the sectors can come together and ensure that they are providing services to the child.
Every 2 years, the ECD network will actually be having this conference because it is the only platform that brings all the 47 counties together. Everybody now will be there to present what their successes and what the challenges have been.
When systems come together, children thrive. When communities lead, change becomes sustainable. And when we invest early, we secure a brighter tomorrow. The ECD Network for Kenya, building strong foundations today for the generations of tomorrow. Every child, every system, every voice matters.
Thrive, right? And I like the quote of Kadenge, ECD is a period, a process, and an outcome. These are the takeaways, please. Get more of this, they will be very important. I know there were two Waziris who came. Abla, do you want to introduce them, please? I could see two Waziris came yesterday. I don't know whether both of them are in the room. Yes, I can see Lukala is around, but maybe just do very fast announcement and we move on.
Thank you, Abdullahi. I have my colleagues, two of them who have joined us. One is Leah Lokala from Turkana CC Education, who is a very close friend of mine. And of course, I have learned from her because she has hosted the last ECD National Conference. The other one is, of course, my vice chair for the Education Sector Forum for FCDC counties, Mr. Wallo, who is the CEC for Education in Lamu County. I don't know whether he's here. Wallo, if you are here, Karibu. Wanga. Thank you.
Thank you so much. Can we clap for them, please? There is another one, please. Can you stand so that we can introduce you? We're very sorry.
Yeah,
Our Waziri is biased to FCDC. Sorry. Yeah, yes. Okay, yeah.
Okay, I said I'm Reverend Simon Kuta, CEC Education Vocational Training Library Services, Baringo County. And I came with some of our officers, director in charge of, and PEO, and also our chief officer was here, but she stepped out. We came last night. This place is very far, but we thank God we are here. Thank you.
Okay, we are also joined, today is a very blessed day. We're also joined by the Director, Policy and Partnership, Ministry of Education, our Dr. Lombasa. Wow, you sat at the back, please, come to the front. The title you hold deserves some focus and attention. We are building partnerships, and your presence will be part of building the partnership. Maybe we should give you a minute, please. I may have mispronounced your name. We want it to come from your word so that the dialect,
Thank you
the
so much.
connotations are properly captured.
Thank you so much, sir. I think I will write on the protocols already established. My name is Lumbasi Bartholomew. I head the Director of Policy Partnerships in the Ministry of Education, and I'm glad to be here, and I'm proud of Prof. I think the inaugural conference was held in Safari Park, and I was reminding Prof, you know, she took me by horns to ensure that I bring the head of state, and I think from that day, out of that communique, we now have a biannual conference, and I'm happy all of you are here. If you just reflected of who you are today, it's very important that you take care of this child, because you know you have no control over your future. And your future is already spent. How many years are you left? Maybe 10, 20 years. You'll be out of service. But the people you are serving have got more than 40, 50 years to serve us. So you'd rather take it today that you need to be very careful and help each and every child to realize his or her full potential. That's my take. Thank you.
Thank you so much, Daktari. We appreciate. Now it's my pleasure to invite Professor Amina Bakar to come over. Yes. Maybe our director, ECD, please come over. Our director, as a professor comes, please make an announcement or please.
Good afternoon.
Afternoon to you.
Yeah, I know he introduced himself, but yesterday we were really discussing about issues of procedures and engagement with the ministry. And so his directorate is the one I was talking about, that most organizations, if you want engagement, then you come and also start with this directorate partnership, the partnership part. That is where you start from. So it is very, very important that you take note of this, because it's what causes the shortcut that we're talking about. And later on you can move so much with that program. And if you don't engage officially and we get a MOU and partnership documents, and also now start engaging with the relevant directorate, in this case ECD, then you are likely to face a lot of challenges which can really take you back. And I know that at times, or most of the times, you do this so that even the government can use your program and the outcomes to inform policy. But we don't inform policy if you didn't work with us. So that is just something that I wanted to enforce, that I did talk about. And now that is around, most of you can look for it, have a side meeting, if maybe there's something you want to discuss with the ministry, even before we come to the table as ECD. So that is what I wanted to remind the team here, and it's very, very important for us.
Thank you so much. So Prof, come over and... Okay.
Hi everyone. I am not prof, but in very many years to come I will become one. Wow. So just to announce, we have poster presentations. So if you came with your posters, leave them at the registration desk. We are putting them on, we are mounting on the wall as you walk towards the reception. We'll mount them there so that when we go for breakaways, you can interact with them and the organization presenters can talk more about them. That's just a reminder. Asanteni. Karibu real prof.
Good afternoon. I think I don't need to use that. Can you hear me? So I'm very aware that we are late, so I'll try to make this very broad topic brief. And the person who is projecting the slides, kindly help. Okay, so I think I've been asked for 10 minutes to try and talk about how do we advance climate resilient childhood systems, early childhood systems, through policy, innovation, and sustainable solution. I think there is no better place to talk about climate, yeah?
Put off the lights so that you can see.
Kindly put off the lights. Okay. So I think there is no better place to talk about this more than Garissa, where it's really the parts of Kenya where the impact of climate change is being felt a lot. So one thing is for sure, we can all agree that across the globe, we are all feeling the impact of climate change. However, the impact is not equal. It varies by regions and even within countries by different parts of the country. Next slide, please. Yeah, so really important that we are able to focus on the fact that even as we talk about the impact of climate change, it affects other people more, and unfortunately, those who have contributed the least to the problem. Next, please. Now, there are very many events associated with climate change, especially in East Africa. These include extreme weather events, so flooding, irregular and unpredictable rain. You know, so we also find that quite a lot of time there is droughts that impact the lives of people and increasing temperatures. So many parts of the world, people are really facing extreme heat And this is affecting lives on various levels. So next slide. So how does this really impact on our youngest? Now, of course, the impact is felt broadly, but I really want to focus on how is climate change impacting on the youngest in the communities. So maybe a bit of statistics I would like to focus on and really highlight. In Kenya, 12 million children face climate and disaster risk. This is when you combine both from moderate to very high risk. That's a huge number of children. And 7 counties in Kenya have extremely high risk. That is Turkana, Samburu, Marsabit, Wajir, Mandera, Garissa, and Tana River. I think all those counties are within the FCDC region. And then 4 additional counties are at moderate risk, high risk, sorry. So the first group was very high risk. This is high risk category. So what I'm really trying to focus on is the fact that the arid and semi-arid parts of Kenya have the highest risks. And the risks come in many forms. So next slide, please. There's really the direct impact of climate change on health. So when we have, for instance, and I won't go through each of that, for instance, extreme heat has been related with aspects such as cardiovascular failures, in terms of the ecology and the spread of diseases, infectious diseases, such as malaria, chikungunya, dengue. All this is changing because of the climate change impacts. Air pollution leading to respiratory diseases, but also water and food insecurity, which contributes to malnutrition, and we know the impact of malnutrition on child development, but also downstream contributes to things like conflict when people are fighting for the limited resources, forced migration, and all that. You know, and what is important to note, a colleague of ours who was at Aga Khan University and worked in a very large consortium, really they looked at community perceptions, or how is climate change, and especially just focusing on heat, impacting on pregnant women. And you can see all these quotes from pregnant women and other stakeholders on the impact of extreme heat on their well-being during pregnancy. I guess what I'm focusing on with this slide is that the impact of climate change will not start at birth. Like every other thing, it starts at pregnancy. So when we are thinking of systems, we have to think of how do we protect pregnant women from all these negative impacts. It has direct impacts on learning. Next slide, please. So for instance, we all know what happened when there's floods. Schools are damaged and there's closure. There's a lot of loss of learning. For instance, part of the really sad stories among these communities with water insecurity is how many hours children lose from school searching for water. And guess which child will suffer the most? The girl child. They will spend the most hours walking around looking for water. But also when there is dropouts, there's dropout because people are searching for pasture. We have had stories of children who are married off early because there's just limited food in the family, and people are trying to really reduce that. Although recently someone told me, Prof, you need to do a study on this. I think we have been marrying off our girls early for centuries, you know. So somebody was trying to contest it, but we accept differing views. But of course, conflicts due to competing resources means children have to move, they're removed from school. But also sometimes the discomfort inside classrooms that are not climate smart. I think you go into these extremely hot settings and the classroom have these roofs that are made of tin, no window, no ventilation. What will happen to the children? They get extremely hot, they are not concentrating on the learning process. So sometimes even the existing infrastructure is not really conducive for learning. Underlying all this, next slide please, is really what I think we can all agree, and two systems heavily impacted that have very direct effects on ECD at all levels. One of the first systems impacted by climate change and predictable weather, drought is what? The water system. We've had a lot of discussions, especially in Isiolo, around the impact of climate change on early childhood as we design a study. And one of the things they keep saying, shida yetu ni nini? Maji. But also, because of lack of water and many other things, such as pollution of land, the food system is also interrupted. I'm not just talking about, when we talk of the food system, it's the whole production line. The land being contaminated, not having enough water, but also foods getting spoiled early because it's extremely hot and people do not have storage, So it's really a whole system approach, and I can't talk about all that, but really these are the two systems people really enforce when they think about how climate change is impacting their lives. So as you would expect, because of shortages in food, water, diseases like malnutrition, diarrhea really become bad, and that will in itself impact child development. In short, if you look at the next slide, if you look at the existing literature, there's just one statement that can summarize when you think about ECD and climate change, is that what is happening with climate change, environmental pollution, disrupted food system, it is really disrupting the abilities of families, schools, the health systems, and community to provide nurturing care. When there are floods and health facilities are closed, people will not be able to go for care. When there are floods and roads are spoiled, people can't travel for care. So I think what one needs to look at it when thinking about the impact of climate change is how is it interfering with nurturing care, our ability to provide it? And I think the core issue is that it impacts on all the 5 components, whether it's safety, whether it's security, early learning opportunities. So the question is, how do we build systems that are resilient? And we know what we mean by resilient. I think in an ideal situation, we'll say, how do we build systems that ensure children never experience the impact of climate change? I think the discussion has moved a little bit from that to how do we ensure that the systems are adaptable. The systems can survive climate shocks. And the systems, in cases of emergency, can quickly work to address the need of children. It's a short talk, so we can't go through many things, but I can look at a few key things. So when you're thinking of the 0 to 3, actually from pregnancy all the way to 3, where do they interact the most? The health system. So our colleague again, Adelaide, did a really good framework. And what's the beauty of this framework? It is based on discussions with community members, healthcare workers, and other stakeholders within Kilifi on what do we need to do to come up with health systems that are resilient in the context of extreme heat. And they came up with 3 clear domains. One approach is really to target behaviors and health promotion. How do we ensure pregnant women stay cool? I'll pick an example of something we love. Muslim women, we like black, and quite a number of times we will wear the full black. And it's extremely hot and you're pregnant. Sometimes that's not the best dressing option. It's as simple as, what can you wear? And I'm wearing black on my head right now. What can you wear that keeps you cool? You consider the color, you consider the material. Ideally, it should be cotton, but it doesn't shine as much as the non-cotton. So we still say we are going to go with the shiny material. But such simple behavioral change messages, promoting hydration, ensuring cooling water and sprays, and really preparing for any potential birth complications. But also we need to think about the health system itself. How do we develop early warning system for pregnant mothers and newborns if there's going to be heat waves? Can they be told early enough today at this time, we really shouldn't be walking around? How do we work very closely with community health promoters, nurses and midwives to be able to monitor pregnant women in times of such risky moments? But also thinking of the built environment. I went to a hospital facility, and I won't mention which one, and there was actually a maternity ward with 12 mothers and no windows. Okay, they said it was an emergency one because theirs had a problem, but already the temperature was 39 degrees. So you can imagine how these mothers inside there were feeling, and a few were actually sharing beds. You know, so how do we ensure the built environment is natural and addresses, you know, like right now we have reflective paint, the thermal protective paints that really ensure that we reduce the heating. You know, traditionally people built in such a way that where the windows were and everything, circulation was ideal. How are we ensuring that the architect of where our children are born is ideal? Trees. I mean, this hotel is an excellent example of how planting enough trees can cool down your environment. Have you noticed how nice it is at the restaurant? Yeah. So we also need to think of climate resilient or climate smart ECD centers. First, empowering the workforce. Are we training and creating awareness on the ECD workforce to really know about some of these issues? You've seen kids dancing around under temperatures of 39, 38. And maybe the school doesn't even have water, and they're right out in the sun, getting dehydrated. Or how do we provide them practical tools? A few minutes, I'll be done. But also there's the issue of upgrading infrastructure. Can we ensure there are shaded playing areas, classrooms with enough ventilation and air, ensuring solar-powered appliances where it's possible, but also design flood resistance classes. One other thing is children need to become active participants in climate action. You know, how do we ensure they are more aware of the impacts of climate change very early, limiting waste, learning to recycle, planting trees, but also caring for them. It's not just about planting, but who cares, but looking at other environmental assets. Like at the coast, our coastline is our environmental assets. Can we make children very early aware on how to protect the coastline? But also adding their voices in the advocacy process. We need research to drive innovation. How are we going to develop early warning system if we have limited data? How are we ensuring that the data we derive is gender sensitive, but also child, friendly and all that? But, so at the moment, the data from Kenya on the impact of climate change, potential innovations and all that is very limited and fragmented. Now, I know I've spoken about different multi-sectorial sectors. One might think, are we going to do everything in different sectors? Like everything else in the ECD sector, you put the child at the center and have a multi-sectorial effort. You get the architect, the agricultural officer, the teacher, the nutritionalist into your ECD center. You're able to build a center that looks at the, needs of the child. But also indigenous knowledge. In all that we do, we shouldn't forget that people have lived in this environment for centuries. They had their own early warning systems to tell when the rain is going to come, when this is going to happen. How are we going to use this indigenous knowledge, but respecting the rights of indigenous people and really incorporate them into our policies, into our actions? So really, in conclusion, to build climate resilient systems, we need more well-designed studies that look at geographical and contextual issues. We need more policy advocacy that takes a really multi-sectoral approach, but we need to build systems that are adaptive and can survive the climate shock, but also empower the different actors and players on how to address issues around climate resilience. And we know from FLOCA and other efforts, community-led action can really have a dent in the way we do this. Thank you so much.
Thank you, Prof. I think so the professor has taken the shortest time possible, right? Despite being a
standing next to me, I had to dash.
Despite being a very sensitive topic, right? Yes. And it's important to note climate smart dressing vis-a-vis beauty smart dressing in a brutal world of sexuality. And it is the truth to talk about it. Because sometimes we need to know why the black dressing, the origin, those who are brown like black dressing, so that at least they can show up better. But then that's the part of the advocacy we are looking at. Let us put the climate issues first for our health. Other issues can come later on, right? So now I want to request Professor Teresa to take over during this panel session. Thank you. Can we clap for the Climate Smart Group? No, we have not clapped for Professor and we are in 10 years of ECD network presence in this country, right? So can we give a clap composed of 10 claps? And how will we do that? You start clapping from the air, 1, 2, 3, 4, 5, and the 10th one you drop. So can we begin from far apart? The farthest you can go. 1, 2, 3, 4, 5, 7, 8, 9, 10 years.
I wish you did that when you are standing. so that, can we all stand up?
Yes.
Just to stretch. Okay. Everybody stand up. I want you to stretch like this. I don't want you to touch. You turn a little bit like this. Your hands down. Then this other side. Okay, we would all start this way. Can we start facing this way? Wow, lovely. Down. This way. Wow, lovely. Down, up. Okay, cold rain, sideways, rain. It goes down. Okay, thank you. So, thank you so much, moderator. I'm now going to invite some panelists who are going to join us. You come and take your seat here. We have Robert Simiu and the group. Robert, you will represent them. Please come and sit here. We have Dr. Emily Sitati. Dr. Emily, where are you? Is she online? Is there somebody monitoring who is online? She's online. Technicians, where are you? Okay, she's not there. Davini Naomi. Davini, do we have you here? Please come, thank you. Mbona mmepigia huyo makofi na mkupigia? Mnajua huyu ni UNICEF? Mtawaona. Mtajua mjui. Okay, we have Kenneth Okelo. Kila mtu na watu wao. Okay, and then we have Professor Catherine Murungi. She's online. Let us give her a clap also. Yes, because now that you are here, we have to serve everybody. So we have a panel of 4 because Dr. Emily seems not to be available. Is she online now? Okay, if she's not there. So we have a panel of 4 presenters who are going to take us through their studies that they have done. And we are going to start with UNICEF. They would want to share because they felt in the morning when we were talking about financing, there are a little bit of details, and I will give Simiu 5 to 6 minutes just to quickly take us through his study before now we can ask the questions that we had prepared for the panel. Dr. Simiu, we are going to start with you on your study focusing on account social spending and child poverty.
Being projected or
This is a UNICEF produced analysis. It's not mine, and is an effort of the office. So UNICEF, as an agency, globally, is the UN agency responsible for the type of issues we are talking about. In Kenya, UNICEF works with very heavily the government, both national and counties, but also with partners. And Prof, I've mentioned this to you, HECO. It is not easy to build the type of movement we are seeing. So well done. So we have three sources of the data that I'm going to speak about briefly. So UNICEF working with the control of budget, the Council of Governors, and all the 47 counties. We normally do data analysis for county spending, actually annually. So we are able to tell where counties are putting money year to year. But then we analyze sort of 4-year periods so that we compare what is happening. Then secondly, we aggregate those spendings into thematic sectors. So we are able to produce a paper on health spending, social protection spending, education spending, and so on. And then UNICEF, together with the World Bank, we recently did an analysis of what we call Kenya Physical Incidence Analysis of government spending, especially in health sectors, in social sectors. So basically asking the money on two things. One is revenue, basically tax. Is it positively impacting majority poor or not? And then spending. When you collect money, you spend. Is that spending reducing poverty, and is it reducing inequality? So in summary, those are new evidence that will be available online. Immediately they are endorsed by the government of Kenya. So in brief, because of the time, colleagues, 0 to 8 years in Kenya, I don't know who knows that population in terms of absolute numbers. Anybody can guess? So how many children in Kenya are 0 to 8 years? You know, we could be talking about something we don't know. 0 to 8 years. Anybody in the audience can tell me? We could be talking about, Mnaweza, you are looking at me. And now I'm pointing to data. Colleagues from DHS, we are talking about 10.9 million children. 0 to 8 years, actually 11 million children. Now, we're talking about human capital development. 0 to 8, if you add another 10 years on these children, they'll be young working adults. Yes. Now, assume we have not invested in the 11 million children. And in 10 years, they are the productive part of Kenyan economy. And me, I'm now 50. If you add 10, 15 years on me, I'll be retired. I need pension. How is the Kenyan economy going to pay pension if you have not invested in the current 11 million children? I want you to ask yourself that question. And assuming these children did not get investment and they end up being poor, they marry early and they produce children. Assuming each of them produces 3 children. So multiply 11 times 3. 33 million poor Kenyans. That's how we do macro simulations, colleagues. And when we project the medium-term look of our country, that's what we do. And the last thing we ask ourselves is, now for us to prevent that poverty, where do we need to put money? And is Kenya putting money in the right places? Okay? Now, the other question I want to bring to the audience, we're talking about financing and investments. I've listened to the group. How many directors, budget, economic planning are in the room from the counties? Directors, budget, economic planning. Anybody from Treasury? Okay, so who links data to macroeconomics to fiscal policy? Who determines ceilings at county and national government? It is Treasury, isn't it? Where are they? And Treasury is both Nairobi and the counties. So, Prof, we could be talking to ourselves. They're converted. So the big question is, so what? Okay? And this is where agencies like the UN colleagues need to partner with you. As we speak today, UNICEF, me standing here with my colleagues, and UKLCDO, we are the co-chairs of the Public Financial Management Development Partner Group, which brings together agencies like IMF, World Bank, and so on, which directly speaks to Treasury on nearly everyday basis. Now, our convening power, you need to take advantage of it, because the type of things we hear here is what then we transpose to these guys who make those policy decisions. So now, the findings, 3 of them, Prof, I sit down. So counties in the last 4 years have been increasing social sector spending, okay? So social sector spending is education, health, water, sanitation, social protection, etc. On average, counties have been taking that spending upwards, okay? So well done, counties. You are actually going above 40%. Now, what is happening when we go deeper and look at that spending, how is ECD share of that spending? So social sector spending is like that. ECD as a portion of that spending is like this, okay? So health, education, etc. put together is on upward trend. But ECD as a portion of that spending is on downward trend. So even at the county level, and remember most of the ECD services are devolved, you are deprioritizing investment in ECD. So we seek to understand why is that happening. And the big reason is you are actually not having data, you are not referring to how important ECD is, and even when you put the money in ECD, you take it out. And I think my brother already mentioned. So you look at the education budget at the county level, 7 to 10% on average for all counties. Then you go in, nearly all of it is going to bursary. Bursary, which is for university students, secondary school students, etc. That's not your function. That's national government function. And the education sector has close to 1 trillion Kenya shillings allocated to it by the national government. So with your little money, you're subsidizing a function of national government. Okay? The second finding is ECD targeted. Please, if there is one message you can take out of me, is this one. ECD targeted spending significantly reduces child poverty. Please mark that. Significantly reduces child poverty and has large society benefits. Basically, it means if you have a business and it is giving you a lot of profit, what do? You expand the business, isn't it? But instead of us expanding the ECD business, counties, you are reducing the business. So when something is working, keep it working. Now, what is the evidence? The inclusion of the child budget reduces poverty rates from 47% to 30% for ages 0 to 5. So you invest towards ECD for age 0 to 5, you reduce Kenya's poverty in children from 47% to 30% in 4 years. A 17% drop. I have never seen such a speedy reduction of poverty in any country. ECD is the bullet, okay? Then for the ages 6 to 12, ECD investment reduces poverty from 44% to 26%, okay? Look at that. It is halving poverty by nearly 50% in 4 years, and from 46% to 26% for ages 13 to 17. A 20-point drop in 4 years in poverty reduction. Isn't this what Kenya needs? So why are we not investing? Okay? Allow me to use these words. We would be stupid. Okay? Then the second thing is that even with that evidence, Kenya is underinvesting in ECD compared to the Eastern and Southern African region. So Kenya is putting per child per year on ECD at $1. The SR average is $183. Remember, Kenya is the economic superpower per capita for Eastern and Southern Africa. Yet, we are investing less than half what the average SL region is putting in ECD. So what is the problem? It goes back to the directors of budget not being in the room. Okay? And then finally, we need to improve targeting. Even where we are putting the money, when we analyze who is benefiting from that money, it is not the poorest quintiles of society. It is the richer cohorts of society. So when you speak about university bursaries, how many poor kids from Garissa here go to university? So you pick a lot of our education money, you put it in university bursaries. As an economy, we think that is very good. But then you are denying money on ECD, where majority of our poor children are. How will you get them to the university? So let's improve targeting, let's improve spending. Finally, Prof, from me, one social sector that is being denied money is nutrition. It is the biggest driver of child multidimensional poverty, but it is the one receiving the least investment, nutrition. So county governments, how do we elevate nutrition investment? Thank you.
Give him a round of applause. Thank you, Dr. Simiu, for the information that you have brought out. And I now agree why you insisted that you need to share a little more of statistics to enhance what we learned in the morning. Thank you so much. I now want to switch gears into the specific studies. And I want to start with my colleague, Professor Catherine Murungi, who is online, if she can hear me. Professor yes. Catherine, I'm seeing you are focusing on governance, finance, and accountability in early childhood development. Can you please tell us how governance, financing, and accountability is affecting early childhood development in 2 minutes? Over to you, Prof.
Thank you so much, my good friend and Director, ECD Network. I'll start with governance. We did a study, and our study was focusing on some 8 counties in Kenya. The details were shared for those members that would want to go into details. So I'll go straight to governance and what we found out. Having looked at governance issues, financing issues, and accountability issues in 8 counties in Kenya. So on governance, we found out that counties with clear governance structures, and in particular we saw Kilifi and Nairobi, these counties were able to demonstrate higher ECD budget prioritization. We were also able to find out that where multi-sectorial ECD committees exist, coordination between health, education, and finance departments improved service delivery, and we were able to see this in the case of Turkana County. However, In counties like Meru, Garissa, governance remains fragmented, lacking a dedicated ECD unit, or what we call vertical coordination, leading to duplication and gaps in service provision. Where it concerns financing, the analysis we then revealed large disparities in ECD budget allocations, ranging from 72% in Kilifi, under 20% in Meru and Nyandarua. We also were able to find out that counties with innovative financing models, such as public-private partnerships and resource-based budgeting, are better positioned to sustain and scale ECD programs compared to those that did not. And we are also able to find that delayed disbursement and lack of budgeting, what we call budget ring fencing, ensuring that money that was meant to go to ECD remains to ECD and is not redistributed or reallocated to other sections, like we've just heard from the UNICEF representative that some of the money would be given to university funding for bursaries. So we continue this trend continue to undermine program continuity in most countries. And then when it comes to accountability, under monitoring and evaluation systems, we realized that they are weak and there was inconsistent implementation across the counties. We also established that there is need for community involvement where oversight is concerned, and where data utilization for decision making is concerned, it was very suboptimal. So, Professor Moma, that is the case scenario where governance, financing, and accountability, as per the 8 counties that we went through, we were able to come up with.
Thank you. Thank you, Professor Murungi, for the insights that you have given in your study. I will come back later to you. I now want to move to Davin. Yes, Davin, your study is focusing on enhancing early childhood development through multi-sectoral collaboration in Homa Bay County. Based on your study, can you briefly tell us how multi-sectoral collaboration is enhancing children's development, making reference to the project you are implementing in Homa Bay? Thank you.
Good afternoon, everybody. My name is Davin Naomi. I'm affiliated to keynote, and we are implementing nurturing care in Homa Bay County under the Smart Start Initiative program. So one of the innovative ways that we have adopted in Homa Bay County is a community-driven multi-sectoral collaboration model. And by this I mean that we have the county MST and we also have the community MSTs. So for Homa Bay County, we have 13 community-based stakeholder committees. Those are the community-driven MSTs. And the composition of these MSTs include the Ministry of Health, Education, Agriculture, Children's Department, local administrators, religious institutions, and also community-based organizations. So the main reason why we picked this model to act upon is because despite national frameworks, despite policies being put in place, we realize that we see a different story in the grassroots because we mainly deal with the community. We see fragmented services, we see limited coordination, we see the community ideas not being taken into consideration during critical decision making. so that we sit in boardrooms, we make policies, but we do not consider what the community really needs. And we can only know this by active participation of the communities. So far, the CBSEs have co-planned and co-implemented interventions grounded in real community needs. And these community needs are affiliated to the feedbacks that we get from the community. So far, we've had more than 370 mentorship sessions for caregivers just to teach them on issues parenting and nurturing care. We have seen increased civil registration under the Huduma Mashinani because our social services are actively involved, and now they come to the community downwards. We have realized more than 480 kitchen gardens being put in place. This is courtesy of Ministry of Agriculture with regards nutrition of the children. We have also had 39 support groups for adolescent girls and young women because we realized that these are parents and they are young people that need to be nurtured into parenthood, and they need to be given parenting skills that are necessary for them. Yeah, that's a brief.
Thank you so much for the insights that you have shared. I now want to move to Ken. And Ken, you are looking at existing ECD and ECD-related data systems in Kenya and Sub-Saharan Africa. And you have some findings and lessons from a scoping review. So my question is, based on your study findings, can you tell us about the status of data availability and utilization for decision making?
Thank you so much, Prof. So I want to give a 1 minute background of this before I go to the scoping review. So APHRC, in partnership with the county government of Nairobi City and Homa Bay and Isiolo. So there are 3 county governments that APHRC have partnered with to establish an ECD data visualization platform. So this data visualization platform is aimed at ensuring that ECD indicators, which are currently being tracked by those respective counties in all the sectors, that is sector of education, child protection, and health, are visualized for ease of decision making. So before going into this, we started with the scoping review, where we were looking at sub-Saharan African context as well as Kenya and those respective counties to see which data platforms and systems are available. What we found out, based on the question that Prof has posed, there are existing data platforms in respective ministries or respective departments. Department of Health has data systems and platform, Department of Education, as well as Child Protection. And on the utilization, access and utilization, the such information or those data platforms, the data that is in those platforms are currently being used. This has been manifested through the publications that are out there that are citing those data sources as their primary source of their information. And even during this conference, we have already, some of us have mentioned or have quoted such platforms as their sources of their data. However, in Kenya, as I had mentioned earlier, that those data platforms, they exist in silos. So if one wants to get an information about child protection, then you just go to Child Protection Department. If you want to get information about children's health and nutrition, you go to Health sector. If you want to get information about child education at the county level, you go to the Education Department. So, however, in Sub-Saharan Africa, we only noted that there are 2 platforms that exist that kind of integrate ECD data in nurturing care framework domains, and that is UNICEF and Tanzania ECD dashboard. So we intend to use such learnings to co-design together with the county government of Nairobi, Isiolo, and Homa Bay to come up with an ECD data visualization platform that is going to incorporate all ECD indicators that they are currently tracking. Thank you.
Thank you so much. I just want to confirm whether Dr. Emery has joined us online. Somebody to confirm for me, just to be sure. Okay. So thank you. I think I will move to the next question for each one of you. And I want to start with Professor Murungi, if you can hear me. From your study, what can you say are the best practices or case studies from the 8 counties where you did your study that demonstrates how integrated governance, strategic financing, and robust accountability structures can be transformed? Over to you.
Thank you, Chair ECD Network. The 8 counties that we went to were Nairobi, Turkana, Kisumu, Kilifi, Meru, Nyandarua, Samburu, and Garissa. And we were able to find out that strategic financing and robust accountability can transform ECD systems from what we were able to dig out from these counties. Now, coming to the best practices, I will tell you what we found out from Kilifi County as the best practice that we can be able to borrow from. We noted that in Kilifi County, 71.8% of the education budget is allocated to ECD. This shows strong governance, intersectoral planning committees that are aligned with county CIDPs, as well as with ECD priorities. Innovative financing was also present because we were able to find out that the public-private partnerships and resource-based funding was used to support ECD infrastructure and even the teacher training. So the lesson here is that if we align with local developmental plans, with our ECD targets, and then establish a dedicated implementation unit, we can be able to do it like Kilifi County did. When it comes to Turkana County, we found out that they allocated a high allocation of 56.7%, reflecting prioritization of vulnerable populations. Strong collaborations between ministries of health and education was present, was visible. Transfers of ECD centers, support fund, teacher salaries, and basic health was something that they were doing. And the lesson we can borrow from Turkana County is that if we prioritize marginalized populations through flexible funding and county-level leadership, we can be able to do it. When we come to Kisumu County, we found that it uses participatory budgeting, whereby they engage communities in planning and spending decisions. We also were able to dig out that the mid-level allocation, they give it a mid-level allocation of 50%, but high citizen accountability builds trust and equity. So the lesson we can learn from Kisumu here is that community engagement improves transparency and ownership of ECD projects. And I'm sure that's why the First Lady of Kisumu County this year is proud of what they are doing. And we can see because the citizens participate, there was participatory
Thank you, Prof.
Then,
Thank you.
In summary,
Yes.
In summary, integrated governance, predictable financing, and robust accountability mechanisms form a mutually reinforcing triad. Strengthening any one pillar without the other is insufficient. So counties must institutionalize multi-sectorial committees to lead and coordinate the ECDs, must allocate dedicated ECD budget lines with transparency in disbursement and utilization, and lastly, develop ECD MIS system. And this one, Prof, I wanted to be my punchline. We have NEMIS for every other student, but when it comes to ECD children, there is no management system. So if we can develop an ECD MIS system to support performance, tracking, learning, and community feedback, then we can say we have achieved, and I hope this is something that some of the counties can report to have done in the next ECD network presentation in the 7th conference. Thank you, Prof.
Thank you so much. And I believe some of the things you are alluding to and the best practices, we have various counties here who can really learn from what you found. Now to Daphne, my last question to you is, what would you recommend to the national and the county governments in relation to multi-sectoral collaboration?
Before I give my recommendation, I'd like to say that as we strive to build a strong foundation for every child, let us remember that nurturing care doesn't begin in a boardroom. It begins in the heart of the community. And if we are serious about nurturing the potential of each and every child, then we must equally be serious about empowering the community structures where these children live. So my first recommendation would be partners and actors should prioritize working within existing structures. I hear all of us complaining about funding, which is a real problem, but if we integrate nurturing care into existing structures, then we can reduce the amount of funds needed for us to do nurturing care for the children. Also, my last recommendation would be that let us invest in communication and creating awareness. Once these people know what they need, then they get to do it. Our intervention should be focused around creating awareness to the community so that one person knows that a birth certificate is important for their child and they do not need funding to get a birth certificate for their child. And things like feeding program. For instance, we have a church that recently launched a children's feeding program in Homa Bay, and the church is not funded by anybody. The parents are the ones funding the program, to mean that if people have the right information, then they can do these things.
Okay, thank you. Nurturing care does not begin in a boardroom. It begins where? That is what got my attention. To Ken, my last question to you, given what you have been able to do, what recommendation can you give in relation to data management or use?
Yes, thank you so much, Prof. So, as I had mentioned earlier, that this is a project that we are learning together with the county government, the three respective county governments, and we aim to co-create together, design the project together, learn together, implement it, and then scale it up to other counties. What we have been able to learn on the data platforms that exist and the data system that exist, we noted that, for example, the UNICEF dashboard that we looked at, the example of that dashboard that we were looking at, we noted that there are some indicators that are missing. the information, the indicators exist, but the information of those indicators are missing. So that means that they are not being collected to be fed into such platforms. So that data gap or data completeness and data quality issues exist. And another thing that we also learn in the process is that human resource capacity building is also mentioned across various platforms. That most of the personnel that are working in the data systems mentioned that they needed more training with the evolving AI, the evolving digital space. Another learning that we also learned was about the data protection. Data sharing data access and sharing might be challenging, but the most challenging part is how do we protect it once it leaves the government ministry or respective department. So that is also something that we learned in the process, that we are willing to work with the respective counties on their existing data protection policies and how we can work through that to ensure that the data that is going to be shared in such platforms are data that is anonymized and the participants' privacy is protected. Thank you.
Thank you so much. Co-create, learn together, and then come up with a solution. To our first presenter, and who is going to be our final, to the final question, Robert. What is the one recommendation based on your study and how financing or to reduce poverty is happening? What is that one recommendation that you would want to make so that we can reduce this poverty through our financing?
I think just this movement here is a strong one. I want us to just be practical. Debt and salaries of government, etc., are wiping out money that Kenya raises. So as we speak, if we go to Treasury now, the answer will be we don't have any extra flexibility. What is the solution? Here I am thinking one of the things maybe we can do jointly is to get the Children's Caucus in Parliament, which is chaired by Honorable Millie Odhiambo, and it's a big movement, for them to actually come up with a bill. Maybe the social protection bill is already providing for a child fund, and then work with this group to actually come up with legislation which sets aside a child levy fund. You see the way we have a roads levy fund, petroleum fund, etc. And then push the government basically to set up a child fund which taps resources from different potentials in government. And I just want to give one example. If today we dedicated just 0.01% of the petroleum levy to child fund, do you know how many billions will raise for children issues in one financial year? So my suggestion is let's go to parliamentarians with practicabilities as a movement. If we were to tap into things like sugar, pombe kidogo, etc., just put a minimal percentage of the existing taxes towards a child levy fund. And then I'm informed that currently there's quite a bit of money that government has put aside through a fund for stadiums. Now, these stadiums constructions will come to an end quite soon. And it is the same sector. Where will that money of the funding towards stadiums start going after the stadiums are completed? Given it's the same sector, can we lobby that that fund for stadiums constructions after they are done moves towards children? And then finally, in innovative finance, There are quite a number of things, and I just want to mention a number of them. Date swaps for children. So Kenya owes quite a number of countries, including China and so on, debt. Instead of Kenya asking these countries for aid, is it possible for us to work with the Debt Department in Treasury to negotiate with these governments we owe money, that instead of us paying them and them giving us aid, that they actually translate those debts into debt for children? So instead of paying China 100 billion and then they give us aid, that they convert their 100 billion into a debt swap for children. So we don't pay back the 100 billion, they transform it into a program for children. Because we are partners, okay? And then we could easily tell, for example, China, I'm using them as an example, that for every road you construct in Kenya, this X percentage of what we owe you, you let it out for us to push that money towards ECD programs. And then we have impact bonds, we have climate financing. I think Professor was online on climate financing, tons of money out here. So climate financing for children, it requires these brains to work together with the people who make policies. And in this case, colleagues, it is Treasury, it's national parliament that moves these things. That's why I asked, where are they in this room? And then finally,
it was one recommendation.
Okay, finally, for the county governments, and there were MCAs in the room. If there is one thing MCAs you can do for us, kindly, is when the budgets are brought to parliament, Mama County ya Bungoma, I'm from Bungoma, please advise the MCAs to demand for an annex on the budget that goes to the county assembly, an annex on spending on children. So the whole budget, and then you just ask, give me an annex on expenditure on children. Great. It will trigger a lot of momentum.
Thank you. Give him a clap. Very important information coming in. But what caught my attention from all that he has said, starting a child fund, looking at the taxes that we have. Suppose we said the 2.7% went, just 1 year, it went to building ECD centers. How many ECD centers will we have? That is basically what he's saying, the taxes that we are talking about. Okay, so I don't know how much more time I have. I want to take some 2 questions.
You don't have time, but you can still ask.
Even 1 question?
Yeah, you can ask 2 questions.
Only 2 questions. Who want to go first? My day is telling me we all. Ask your question, just one quickly, just one. Bullet. The microphone is here. Yeah. Make it brief, straight to the point, please.
Good afternoon.
Good afternoon.
I love Robert so much. The way he's thinking is very nice. And my question is, because Robert has said that he works very closely with the national government and the county government, I want to know whether you have got a chance to share this information at that level. Okay. Thank you so much.
Thank you so much. A quick one. There was another hand somewhere. Now the question has been asked. It was similar. Okay. Let Robert respond. That is a quick and straightforward question. Okay, you have one?
Just one quick one.
Okay.
I know that, Robert, politically this tax thing is sensitive. So how do we navigate that, asking for levies, tax, and so on, in this political context? How do we navigate that?
Okay, Robert can respond. Combine them.
Okay. You are not asking for more taxes. No. Okay. You are asking for, within the existing taxes, is there a minimum 0.something% that can be earmarked for a child fund? And it's palatable to politicians. Ask yourself why. The votes come from the mother and the father, the owners of the children. Okay? And then whether we have disseminated these two, we continuously do. Our main audience colleagues is the parliamentarians and the MCS. It is them who will push triggering of financing reforms. And then the people who sit in treasuries, both Ministry of Finance and at the county level. So we continue advocating, but let's build a movement together towards that.
Thank you. Let us give them a round of applause, a good one. I think we managed our time well because we started late. So thank you so much. And I don't know whether, have you taken us a picture? Can we stand here? Yeah. So you can, MC, you can continue. Okay.
Where is the photographer?
Sally, the room's allocation. It's already late. But we need to go to the rooms. Let me give to Sally to announce on that. Do we start with the room or we start with the
I think you can announce for the first one. This one we have.
The one for this is the first one?
Yes.
Are you sure?
Breakout from 1, Kifaru, by Dr. Elizabeth Kivuka.
This is Dr. Elizabeth is here.
This one.
So Breakout. Yeah. Okay. On the rooms, room number 1 of Dr. Elizabeth Kithuka, which is on from vulnerable to valuable, we will be at Kivaru. Room number 1, Kivaru. Room number 2, Breakout room 2, of Mr. Yusuf Gedi, we will be at Yusuf Gedi, we will be at Swara, and Yusuf was handling on strengthening early childhood development systems. So Yusuf, is Yusuf around? Yusuf? Maybe you, okay, good. So room number 2, which is Swara, Dr. Benta Owino's team will go to Chui. Dr. Benta is handling on governance, finance, and accountability and early childhood development. We will be at Chui. And finally, Dr. Abdelkadir's team will be at Nyati. And Dr. Abdelkadir is handling issues to do with climate resilience. So we will be here. Is Nyati, where is Nyati?
On the other side.
On the other side. So you will be at Nyati. So group leaders, please lead them so as to make sure we take at most. Yeah, it should have been 40. Can we take it to 35?
No, 40. We have reduced it already.
Eh?
We have reduced it already.
You have reduced it?
40. Let it go to 40.
Okay, 40 minutes. It has already been reduced 40 minutes. And from there, we are going for tea, please. So let us make sure we immediately go.
After tea, we can have gallery walk.
Yes. Okay, please.
Hello. Then after we get out of the tea break, the 4 p.m. tea break, we can do gallery walk for the poster presentations. You can see the posters on the way to the reception. Yeah.
Okay, people should start walking to their rooms, please.
Bwana Yusuf Gedi. Yusuf Gedi. Karibu. Ita watu wako.
Thank you. Thank you. Mr. Robert Bonyo. Mrs. Shisuku. I think those two are virtual, so I will call the physical panelist. Benta Jacob. Benta Jacob. Honorable Beatrice. Beatrice Nakoli. Francis Kidaki. I only got one, so, but I think the other two are virtual, so. Nelius. I think we have only one panelist, so we only have Beatrice. Is there someone checking on the online, the virtual ones? We have two who are virtual, right?
Jacob is not here.
Who's the other one? Benta Jacob is not around?
She's supposed to be around.
Benta Jacob.
And then the others are virtual. Let me get the virtual.
Okay. I think someone's confirming them. So
is it legible that we say together?
It's fine. Until the rest will come, you can.
Let me get a notebook. Maybe somebody can ask a question.
Yeah.
The boss. Donor support. Budget appropriation.
Is something happening in this room?
Yes. Fosana.
I'm in this group also.
Oh, you're a panelist.
No, I'll be presenting.
Oh, yeah, it's here.
Yeah.
I'll be presenting on behalf of Francis Kidaki.
Kidaki, oh.
And Nora.
So meaning then for you, I will give you a chance for you to say your bio because
next
it's
week.
not part of, or send me on WhatsApp, take my number, 0724. Francis Kidaki from UNICEF.
Yes.
So what's your name? So
Charles
Francis,
Mondi.
I think you will be replacing Francis. You'll be replacing Francis. Okay.
The 7.
Sure.
The 7.
24. 81. 51. 02. So what's your name?
Charles Mondi.
Okay.
From
so
UNICEF
then you
also.
can send me. Hello, hi everyone. I think we can start. We can have a seat so that we can start in the interest of time. So I want to acknowledge the panelists. We also have online participation. So we have some of the panelists that are joining us online, Mr. Robert Bonyo and Mrs. Shizuku. Both of them are attending this session online, and they are going to be making their briefs and also responding to our questions virtually. So, Mr. Robert, if you can hear me, you can say hi. Mr. Robert? Mrs. Shizuku, if you can hear me?
Yes.
Okay.
Can you hear me?
Yes, thank you. So I want to start with the panelists that are with us here for them to say hi. So I'll start with you, Charles.
Hi, my name is Charles from UNICEF.
Charles from UNICEF. Thank you. The next panelist.
Hello, I'm Benta Jacob from County Government of Siaya.
Benta Jacob, thank you. Next panelist.
Good afternoon, Bitus Naholi, County Government of Busia.
Thank you.
Hello, panelists. I'm Dr. Barasa, the County Director of Education, Busia.
Thank you. I don't know if Mr. Robert is there. Mr. Robert? Then I think we can proceed. So our session is going to be discussing on strengthening early childhood development systems. We have a brief from the panelists, and then we will have a few questions for the panelists, and we will open it up to the audiences for also their questions. So I will start with the online team. Mrs. Shizuku, if you can give us a brief on your paper.
Hi, thank you very much, moderator, for the introduction. I work for an NGO, Health and Development Service, HANS, in Kericho. Our abstract title shown in the program is not updated. I apologize for that. The final one is a multi-sectoral community-based project. ECD centers open to their communities for better under 5 nutrition in Kericho County, Kenya. JICA Partnership Program 2022 to 2026. And then let me give you basic information about this project. In this project, there are 5 major programs ongoing till 2026. Those 5 programs are: 1, feeding program sustained by parents' contributions only. Number 2, growth monitoring by ECD teachers. 3, ECDE model kitchen garden. 4, regular household visits by community health promoters. And 5, a monthly program for 2 and 3-year-old children and their caregivers called Play Circle. Except for the household visits, all 4 programs are happening within an ECD center. Can I answer the questions now, or I have to wait until you give us a question?
I will ask the question after you have completed your brief, so you still have a few more minutes for you to give us a summary of your research paper and also key outcome.
Oh, I'm sorry. Okay, I'm sorry. And as a sustainable model after 2026, we came up with an idea called the ECD Nutrition Day to help each school continue demonstrating its leadership for young children's nutrition and health. It is designed to maintain essential features and functions of these 5 programs as much as possible, packaged into a once-a-term half-a-day school event, inviting parents and community people, organized by each school and its multi-sector departments. Okay. I'm sorry, I wasn't prepared to give you the key findings and things like that yet.
Thank you.
That is our brief.
Thank you. Thank you. We'll come back for you in terms of questions. I want to recognize also the presence of Dr. Hudson Ouko, who is also joining us on virtual. Dr. Ouko, you can say hi.
Hi.
Thank you.
Thank you.
Thank you. So I want to give you this chance, Dr. Ouko, for you also to give us a brief on your paper.
I want to appreciate the fact that I've been able to join because it hasn't been very easy from my side. But now that you have given me the opportunity, I appreciate greatly. I have a paper I want to present. It was to be presented earlier, but you have given me a slot in your panel. But I'll be very brief. Sister papers from a similar, project have been presented. I'm presenting a paper on the RCT intervention in Tharaka Nithi County, Kenya, that was informed by the baseline, survey that was done jointly by Kenyatta University WeHub, that's Women Economic Empowerment Hub in Kenyatta University, together with other stakeholders, including, Yale University and the Tharaka Nithi County government. What was the issue? The issue is that Tarakaniti, as it were, in her own ecosystem, has got almost all aspects of climatic regions within that county. And therefore, women are the first line of disadvantaged lot, including the children. Women Economic Empowerment Hub works towards ensuring and promoting women empowerment. That therefore had to, motivate the baseline study that about findings that women were only 8% in formal employment. As many as that 5% were also, in casual labor. Plus other statistics, I don't want to belabor. We already have those statistics with you. Now, that was the issue. The issue in this conference, you can see it surrounding and it's around the child for whom I've read myself. But you cannot help the child develop if you don't help the mother. So the mothers are very disenfranchised to the extent that, if the mothers are not happy emotionally, psychologically, then they cannot give much to the children. And therefore, children find themselves at the receiving end, particularly in accessing quality care that could help them transit school. Now, what's the question? The question is that, where are the 3-year-olds? When the survey was conducted, it was found that most mothers complained about the fact that they had to remain at home doing nothing because they had to take care of their children who are 3-year-olds or thereabout. The hypothesis, it was that then suppose these children are given a very befitting program, an interactive learning pedagogy, and of course supportive staff, and a supportive ecosystem within the classroom. What will happen? The mothers will go and engage in income earning activities. The mothers will be happy, the children will develop, and they will be ready for school. I won't stop at that because we are in the panel. But when questions come as well, we are here to engage. Thank you very much for seeing me, moderator.
Thank you. Thank you, Dr. Auko. Sorry, I forgot to introduce myself, and that's why Dr. Auko is calling me moderator. So, Dr. Auko, I'm Yusuf Gedi, and sorry, that was my mistake. So, yeah. So I want to give a brief background on the two virtual panelists, just a brief summary on their bio before I now come back to the physical panelists. So, Mrs. Shizuko completed her master's degree program in public health, health promotion, education and behavior change at the University of South Carolina, Arnold School of Public Health in South Carolina, USA. She works as nutrition project manager for HANDS, that's Health and Development Services, Kenya office. Her interests include child nutrition, community health, the development of behavior change communication, and instructional materials. The most recent behavior change communication material she developed by her and her team is a picture story book called The Marvelous Hen My Grandmother Gave Me, a story inspired by a traditional custom of the Kipsigis people in Kenya in 3 languages. So that's a brief on Mrs. Shizuko. In terms of Dr. Hudson Ouko, is a senior lecturer in the Department of Early Childhood and Special Needs Education at Kenyatta University. He holds a PhD in education, early childhood studies, and has a strong academic background in early childhood education, Having earned all his degrees from Kenyatta University, Dr. Auko's scholarly work focuses on child growth and development, early learning, foundational education, special needs. His research also explores critical themes such as the role of language in literacy acquisition, the impact of play on learning, and teacher preparedness in the context of competency-based education and 21st century skills. Dr. Auko is widely recognized for his contributions to the education policy and innovation. He is one of the early childhood experts in Kuwe Hub-led initiatives promoting early enrollment and women's economic empowerment in Tharaka Nithi County. He has served on several strategic boards and is part of Kenyatta University Committee developing TVET-aligned programs. With extensive experience in CBE content, Dr. Auko continues to influence national education reforms and remains a respected voice in early childhood foundational learning in Kenya. I will go to Benta Jacob in terms of a brief. So, Benta Jacob is a dedicated early childhood development specialist with a strong academic foundation and a deep passion for holistic child growth. She holds a Bachelor of Education, Arts and Diploma in ECD from the University of Nairobi, complemented by professional certifications from Riara University and the Tayari program, an initiative designed to enhance school readiness. Her career has been shaped by hands-on experience as a trainer of a preschool teachers, where she nurtures education to cultivate environments that support the full development of young children. With an unwavering commitment and inclusive caregiving, she also leads training sessions on nurturing care for ECD, reaching caregivers and teen mothers with empowering knowledge and practical tools. Benta coordinates dynamic entertainment activities and develops locally appropriate learning materials to enrich ECD programs. As the county focal point person for the nurturing care for ECD initiatives, the school feeding program, she plays a strategic role in driving child-centered policies and interventions across the county. I will now move to Beatrice Nakoli. Is a distinguished academician in the field of education. She is currently the County Executive Committee member in charge of education and industrial skills development in the County Government of Busia. She previously served as CCM of Health and Sanitation, and she actively involved in promoting health initiatives to address malnutrition, wasting, and stunted growth issues among the children, ministerial hygiene, and improved access to sanitary pads for school-going girls to reduce absenteeism and support the children and girl child education. Honorable Beatrice taught international schools like Rusinga Group of Schools, an alumni of Bunyore Girls Secondary School. She studied her O-level at Bunyore Girls. She holds Masters of Arts degree in Social Transformation, Bachelor's of Arts degree in Sustainable Human Development from Tangaza University, and Diploma in Education, Kindergarten Teaching. She has extensive expertise in book writing, in language, education, applied linguistics, international advocate of education, and community participation in the welfare of children. Honorable Nakoli is actively involved in leadership and research, publishing an article on factors enhancing sustainable waste management in schools in adaptation of climate change. The journal article provides smart sustainable solutions towards managing and eradicating the waste in the institutions. Honorable Nakoli has attended conferences in Dar es Salaam and Ghana on scaling up nutrition using homegrown models by supporting local cooperative societies She has developed policies that enhance the development of small-scale entrepreneur in the county to address economic stability, social cohesion, innovation, and technology on adaptation of climate change initiatives in the global world. I don't know if I left out on any panelist. Sorry, maybe if you want to, sorry? Okay, okay. Thank you. So lastly then, I want to also give a brief on Charles. Charles is an established nutritionist with over 17 years progressive experience in designing, implementing, monitoring and evaluation of health and nutrition programs at community, hospital, county and national level. He has built his wealth of experience by designing and managing health and nutrition programs in arid and semi-arid lands of Kenya like Marsabit, Kitui, Turkana, Baringo, Samburu, and Garissa counties. He has contributed significantly to holistic child growth and development through evidence generations and knowledge sharing by providing technical assistance to government officials and other partners in the planning, implementation, monitoring, and evaluation of health and nutrition programs, as well as conducting nutrition surveys and research. He holds a Bachelor of Science, a Home Science and Technology, Food Nutrition and Dietetics, which is his major from Maseno University, and he's currently pursuing his master's in research methods. So I hope I've not left out any panelists. Now I want to give this opportunity to Benta Jacob to give us in less than 5 minutes a summary of your research paper. Thank you.
The program that I'm going to talk about is about multi-sectoral approach to child development, a 2-year program pilot in Siaya County. Siaya County has started a program which was launched by the governor in February, and the program is targeting the preschool learners in the entire county. And this program, again, is only dealing with public schools where we have a total of 53,000 learners that are benefiting from the program. The program is put now to help us improve in child nutrition, boost enrollment, and enhance school transition. Those are the goals that we have. And the objective also is to improve child nutrition by reducing malnutrition through targeted intervention. A second objective is to increase school enrollment through access to quality education. And the third objective is to enhance education transition by improving the transition from preschool to primary. So the school feeding program initiative in Siaya is linked to agricultural sector, the sector of agriculture, where we target that we produce the local foods that are provided in the school. So as I said, it is a multi-sectoral. We are working together as a team. All the departments of the county government of Siaya, we come together, and under nurturing care for ECD, we pool the budget, where we have a budgetary allocation of 2 million from each department brought on nurturing care for ECD, and like budgetary allocation for the school feeding program, we have 60 million, and we hope we will manage. Thank you.
Thank you. Thank you so much, and for also keeping time. So we'll come back to your questions. We can now go to Beatrice, Honorable Beatrice.
Okay, so thank you. Thank you, Mr. Ged Yunisu, for the opportunity. Very close to what Sarah has just shared, in Busia we also have a school feeding program. This program is a homegrown solution where we procure. We have over 45,000 learners in all our ECD centers across the county, in 451 centers. And so all of them are fed on a hot meal that is rice and beans and vegetables for balanced diet. What happens is, as I've said, it's a homegrown solution, and so before I go to what happens, so the objective, of course, is to provide a hot, nutritious meal to the learners to improve enrollment, retention of ECDs, to increase attention span and school attendance, to promote partnerships with stakeholders in supporting ECD meals and nutrition intervention program, to enhance effective monitoring and evaluation, reporting and nutrition programs in ECD centers, and strengthen the capacity of management committees. And so what happens is the schools, all of them, we feed them twice a week. The rice is procured from the farmers in Budalangi, and this money is paid directly to them. And so that's one aspect for the homegrown solution. The parents provide the pulses, the beans, that's their contribution. They also pay they contribute in paying the cooks, who are the community people. We use some cooks from the schools who cook for the primary school children, but you also have some employed by the parents, so they contribute that. So as you can see, it's a blend of, for sustainability, we actually procure. That means that the monies are going back to our farmers through cooperative societies. So it is a methodological approach where you have departments coming together. We have, of course, the education department taking a role, health department taking a role, agriculture department, water department, and so they come together and just ensure that that program runs effectively. Apart from that, you also use the community involvement from the project management committees at the school level, supervise the school feeding program. And so it's a very cohesive and collaborative effort. Thank you.
Thank you. Thank you so much. I think community involvement and community engagement was coming out strongly there. We'll come back to your question. We can now go to Charles. A brief on your paper.
Thank you so much, Mr. Gedi. And I will just take a few minutes to look at the accelerated holistic child development. And this is in evidence of a project that we carried out in West Pokot. And here, just quick profile of West Pokot is that there's still a high burden of malnutrition with 34% stunting, and about 2 in every 5 children where you'll find that they have chronic malnutrition. And another key indicator of West Pokot is that sanitation, open defecation is high at 42.7%. And because of this, what Nutrition did, UNICEF together with partners and the county government of West Pokot, is develop a program where we have the community-led total sanitation, and then we brought about nutrition intervention so that we can have a multiple approach towards alleviating the malnutrition problem in West Pokot. And as all of us are aware, when you have diarrhea, what does it lead to? It may lead to child getting undernourished. And a malnourished child, of course, that child's immunity is low, and therefore, again, it exacerbates the problem of diarrhea. It brings a vicious cycle when you have children who are experiencing diarrhea, and similarly, they're also having a problem with malnutrition. And therefore, to alleviate that, we have the traditional approach of doing what we call community-led total sanitation. And this, I know some of us are not conversant with what CLTS approach is all about, but in brief, it means you go to the community, bring them together, and then you help them to realize that doing open bedification is polluting the water. And through this, like now the bottles of water that are in front of you, you come with fresh sheet, and you put inside, and then you shake and you let them to drink. And tell them, can you drink that water, which has shit inside? It brings about disgusting and a feeling of shame. And through that, then there is that provocation to be able to do what? To construct latrines. And now when we do that triggering, nutrition component of now coming to their community and having sessions with them. We do two sessions with those particular caregivers. One, it's on telling them about hygiene, toddler hygiene, and how to be able to avoid fecal matter for children. And secondly, we now talk about issues of nutrition, exclusive breastfeeding, for importance of exclusive breastfeeding, importance of good complementary feeding, and also importance of visiting the health facility to receive services like vitamin A and deworming. And then when that happens, what have we seen as the outcome of all that we have conducted in West Pokot? Facts are there that in West Pokot County, open defecation decreased from 42.7% to 32.3%. In 2019, it was 42%, meaning of every 5 people that you can randomly select, 2 are doing open defecation. But currently it has reduced to 32% by 2024. Then there were 2 particular sub-counties. There are 5 sub-counties in West Pokot. That is Pokot South and Kipkomo, where they have been claimed to be open defecation free. For example, Pokot South was 28% high. Now it is 0%. And above all, we have gotten 1,667 villages that has been certified open defecation free. Our target was about 3,000 villages. You can see that it's around 57% of the villages that has been claimed to be open defecation free, an achievement that we have seen thereof. But above all, there has been contribution, there has been outcomes that we can attribute to nutrition. And one of them is the decrease in malnutrition. In malnutrition, we look at 2 things. We look at what we call chronic malnutrition, that is stunting, and we also look at wasting. In looking at chronic malnutrition, that is stunting, it has reduced from 45.9%. Almost half, 1 in every 2 children in West Pokot are short for age. But with that kind of intervention, it has reduced to around 34%. And wasting has reduced from what it was there before, 14.5 to around 13%. But above all, we have seen an uptick of information, uptick of new behaviors, especially construction of latrines, and our communities also developing that aspect of having behavior change. But there's one thing I would like to say as a lesson that we have learned as I close, Mr. Ngedi. It is that when you bring integrated social behavior change approaches together, they help in uptake of interventions and sustainability of those interventions in the community. And number 2, stakeholder engagement, where you bring on board state and non-state actors when they work together. It is a good thing to ensure that we sustain the approaches and, more importantly, accelerate uptake of interventions that we are doing in the community. Unlike when you have interventions that we do in silos. For example, watch programming, they move alone. ECD programming alone, nutrition programming alone. But when you come together, because you are targeting the same child, of course, you are able to achieve more results. And finally, it's good also to invest in this particular sector. And there's a platform that has got a very good political will. That is the primary health care. It is there in the manifesto of government, whereby looking at the PHC, we can be able to take opportunity and leverage on that platform to be able to fast track some of the interventions that we'd want to do in the ECD. Thank you, and back to you, Madam.
Thank you. Thank you, Charles. I think we can now come to the questions, and I will start with the virtual team. Shizuku, I don't know if you are still there. Can you hear me?
Yes.
Okay, so
yes.
Shizuku, I wanted to ask you a question on your paper that was titled Multi-Sectoral Community-Based Project, ECD Centers Open to Their Communities for Better Under 5 Nutrition in Kericho County. We wanted to hear how the existing nutrition outreach activities that target the hard-to-reach areas can be integrated into the community-based ECD center approach. Generally, a discussion on how this successful approach that you have explained in your paper can be integrated into the existing nutrition and medical outreaches that are currently being supported by the other stakeholders.
All right, thank you very much for the question. Before diving in, I just want to give you a brief kind of picture of 4 ECD centers we've been targeting since 2022. And Kericho is known as a adequate rainfall and things like that. You may not believe there is no wasting. But one of the ECD centers, when we found, its wasting rate was 81%. In ECD PP1, PP2, now reducing to 30, 40% or 20%. So there are those spots in Kericho which not utilizing what the resources they have. For example, lands for a home kitchen gardens, not utilized properly. So they're still wasting in a high rate. So that is what we are targeting. Let me answer the question, how can the existing nutrition outreach activities that target how to reach villages be integrated in the community-based ECD centers approach? My answer is, it can be done in a way that both or even all parties involved win. Let me just give you one example. It is our growth monitoring during the ECD Nutrition Day. And one of the existing nutrition outreach activities I'm talking about is the Action Day. It can be integrated to create a win-win scenario for schools and as well as the health department. By the way, growth monitoring is mentioned as a standard practice in a national pre-primary education policy standard guidelines. Everyone may know it. During the ECD Nutrition Day, joint growth monitoring PP1, PP2, and 2 and 3-year-old from the community is done by ECD and health teachers and a team of community health assistant and community health promoters. This community health team utilizes the action days to come to the ECD Nutrition Day. This organized event gives the Department of Health Services an opportunity to capture a large number of 4 and 5-year-old children, as well as 2 and 3-year-old children they find very hard to reach. They can even initiate a referral immediately for a child identified at risk. In addition, other multi-sector departments such as agriculture and of course education find the ECD Nutrition Day a great opportunity to disseminate health and nutrition-related knowledge and skills to the visitors to the Nutrition Day. This event amazingly requires almost no cost to run once the community health team and ECD teachers are properly trained and provided right measuring equipment and which would be maintained by the Department of Health Services. In my opinion, in a county department plan, this must be listed under school health because the primary ownership of the growth monitoring PP1, PP2 must remain with the ECDE. Since messages from school can be very, very effective, especially for parents of ECD children. That's the answer to question number 1.
Thank you. Thank you so much, Shizuku. Well noted. The multi-sectoral approach to strengthening of ECD was coming out clearly in the answer of Shizuku, where she said it is a win-win for both education and also health. Like, the referrals that can be done by the school to the outreach, where maybe a child can also be attended to, and also, the growth monitoring in BP1, PP1, PP2, supporting teachers in terms of, giving them the skills on how to do this. So this takes me to Honorable Beatrice. As a key member of the county government and a decision maker, how can county government embed and finance school meals and nutrition interventions as a core component of their ECD system to ensure long-term sustainability and equitable coverage?
Thank you very much. I just want to give a brief that our study was about the impact of school meals and nutrition program, and that how it leveraged to support the ECD. Now, for this program to be impacted fully to the learners, that is, we are targeting group to us. First, we provided the basic legislative framework that we have developed our ECD Act. From the ECD Act, we also be able to develop our school meals and nutrition policy. And the policy, we went further and also be able to develop the implementation framework for the policy for us to achieve the maximum. But all that, we have also been working with the support of our partners, especially UNICEF, has really done proud to us to make sure where we have reached to attain the relevant legislation. I also want to state that for financing school meals and nutrition is a collaboration of many players. First, as a county government of Busia, we have a budget line. We budget every year towards the school learning, school meals and nutrition. And this financial year, we have already budgeted 40 million to support the learners. Apart from our budget line, we collaborate with parents, where parents are able to provide beans. And we are, according to the nutritionist, it was agreed that 2 kilograms could be able to feed these children a term. So we only request them only to bring for us 6 kilograms of beans that supports our learners. Then the third option, how we finance our school meals, is through collaborations and partnerships with our development partners. In this case, we have also been supported by NICE program. It's also an organization working in Busia. We have also been supported by World Vision that also operates in Busia. At their level, they are able to provide a substitute to the beans, but the county government has always been able to provide rice in all our institutions. Basically, we find that even the rice that we purchase come from our local farmers. And that's why we rooted what we refer to it as a homegrown solution, where all the actors, the foods are obtained within our communities, and the money goes back to the farmers within our setup. Ideally, our school meals and nutrition program, it is a financial model that anybody can be able to adopt for it to be sustainable. We found that if we only rely on our budget line, we may not sustain. And that's why we went to develop a homegrown solution to increase and support and sustain our school meals program. Thank you.
Thank you so much. So, key takeaways from there: homegrown foods, local solutions, financial model that is sustainable. And this takes me to Benta Chako in terms of promoting transformative, systematic change in child's ecosystem. How can school feeding program be reimagined beyond nutrition to serve as a strategic anchor for strengthening early childhood development systems, including health, early learning, and family engagement?
Thank you. The incorporation of nutrition in nurturing care activities is what we are using as Siaya County, where the 5 components of nurturing care for ECD are incorporated, starting with good health. As we all know, nutrition supports immunity and healthy growth that reduces disease. So that one, practically, we integrate nutrition counseling in child wellness clinics. At the same time, the provision of vitamin A supplementation and deworming done in the outreaches. And we also promote maternal nutrition and iron folic acid supplementation during ANC programs. At the same time, we promote exclusive breastfeeding for children who are 0 to 6 months. When we live good health, we go to adequate nutrition, where core to child development, as this fuels brain and body development. So there, we support timely, diverse, complementary feeding from 6 months with continued breastfeeding. We also organize community cooking demos using local foods. We train caregivers on active feeding and recognizing hunger cues. Also, we use CHVs to follow up on feeding challenges at household levels. That one now, we are working together with health. Another part that we do, we include feeding time as bonding time in parenting groups. As we train the parents, we encourage them that feeding time should be bonding time. Another one is responsive caregiving. That is another component of nurturing care. And in responsive caregiving, we all know good nutrition enables brain development for learning readiness. So what we do as a county, we educate parents on the role of iron-rich foods for brain development and also provide nutrition talks at the ECD centers. Another component is opportunity for early learning. So, as a county, we all know if the child is given good nutrition and the brain has developed well, the child will concentrate in class. So we link ECD attendance with snack programs, and that's why we said we have fortified flour porridge for our learners. We also provide, I said we provide talks to the ECD, to the practitioners of ECD, and promote also food handling and water treatment practices. That is under opportunity for early learning. And the last one is security and safety. We only know that a safe environment ensures food hygiene and nutrition support is sustained. So our learners, in order for them to be secure, the environment has to be safe. And whatever they are using also has to be safe, in that water is treated, the environment is clean, the surrounding is okay, and even the things that they are playing with are safe. Because we know at tender age, children, they tend to like putting things on the mouth. So we encourage hand washing before meals and even after leaving the toilet, or at preschool center after play. We also support kitchen gardening and secure food storage at the household level. Thank you.
Thank you. Thank you so much. Good nutrition, good health, safe environment, hand washing contributes to also, safe environment for ECD. This takes me to Charles in terms of how can integrated community-led models like sanitation, nutrition that you demonstrated in your paper, accelerating holistic child development, evidence from sanitation and nutrition integration in West Pokot. So how can this integration of the community-led sanitation and nutrition be institutionalized and also scaled up at the national level? So this was a successful one at county level. So we wanted you to discuss on how this can be integrated into national reforms and how it can be scaled up to also the other counties.
Thank you. A good question. And here we are looking at opportunities for scalability and even replication of such a successful integrated program where we have the WASH or like sanitation with nutrition programming working harmoniously to be able to address some of the critical problems that we find in children under 5 years, that's malnutrition. And one of the key things is approach it using integrated multi-sectoral programming. And I said, for example, and at national level, we have seen a program called NICH, Nutrition Improvement through Cash Health Education. It is hosted at the Department of Child Protection, and UNICEF becomes also a player in other sectors, so that all the households, for example, that are being given resources because they are vulnerable, maybe because of old age or because of orphan and vulnerable children, that monthly stipend that they receive, they are educated on how to be able to utilize that money. So it doesn't become a single aspect of providing resources or cash to those households, but also bringing information, health education and nutrition education, and that integration can contribute to alleviating some of the issues that we find that people are struggling at community level. So we need to have government-led initiatives so that they can maximize reach, and also can be able to have long-term impacts by by sectors coming together, be it social protection, agri-nutrition, be it WASH, they work harmoniously. And secondly, and I mentioned it earlier, is to take opportunity of the primary health care, that is the UHC-led financing. Because it is a government-led, that can also enable sustainability and also become preventive focused rather than where we are not looking at preventive, but we are more of treating issues. So it becomes a good opportunity to layer on health and nutrition programs that can focus on early childhood development. Another critical issue is looking at the localization of market-driven sanitation innovations. Because we are promoting issues to do with sanitation, yes. How do we ensure that we also partner with the private sector that are producing or doing issues to do with technology and components of sanitation? And that localization can also involve good outcomes and also drive the industry growth, and also socioeconomic gains will be realized. And finally, it's also good to have policies and legal alignment that can also bring impact, where you look at what is already there, and then how can we be able to align our programming to what the county and also at national level has been outlined as the policy and legal framework and guidelines, rather than when you do things by your own and you are not aligning them to what is contributed at the county and national level. And such documents like National Nutrition Action Plan, you can have the Kenya Sanitation Alliance, there's what we look at like the Global Action Plan for wasting and prevention, and other things like SDGs that we can subscribe to. Thank you.
Thank you. Thank you so much, Charles. So, key to note is the fact that we need to be layering on the already existing intervention so that then we reduce the cost. So that when we are adapting this into already existing programs, then it's not going to come with additional cost. But then the same programs that were already ongoing is what we are going to use it as an opportunity for sustainability and also for layering. I don't know if Robert is still online. Robert Bonyo? Okay, so if Robert is not online, then I can now move to Dr. Hudson Ouko. Can you hear me?
Very well, sir.
Thank you. So I wanted to ask you a question on your paper on lessons from the baseline survey on women's work and employment in Tharaka Nithi.
You are welcome.
Okay, so if pre-primary enrollment at age 3 gives mothers more time for income-generating activities, what systems or supports must be in place to ensure this time is actually used to improve their economic status? Over to you, Dr. Ouko.
Thank you very much, and a good question. That is the point I will say that it is very intricate, particularly to think about the child independent of the mother. And this is where our intervention is coming from, where systems that should be put in place, and I'm happy with the presentations of the day, where multi-sectoral approach is the way to go in terms of, addressing those issues that affect the child. And we are talking to the point that you cannot essentially do much on a child whose mother, stroke caregiver, is not on board. So in Kenya, you are aware that we have a policy framework that demands that 4-year-olds are ripe enough to join PP1. And given that the baseline showed that most mothers are like, we have nowhere to take them, coupled with the ecological systems that are available, you find that mothers don't part with their children, and that leaves them redundant. So we are saying that when this intervention comes to ripe, we're likely to get good data, good information, which is not existing, because I'm a child specialist, and most of what we talk about is that do ABCD, intervene like this, join hands for the child, but we are quickly remembering that this can only work if we empower the mother. So we are putting forward a foot that, look here, the mothers once looked at, the children will be comfortable and they'll achieve well. Their trajectory to development will be just very, very achievable. And the mother, once happy, she'll also have earned what could make the household, more alleviated from the available status of poverty. It is a project ongoing. Chairman, I don't think we need to make recommendation at this point in time. It is actually in the mid-year. What we know is that mothers are underemployed. They are not really doing very well in terms of, income earning, and they are involved very sparingly in the employment sector. What about the children? Our experts who went to assess the children were able to help us see that even the 3-year-olds were having positive trajectory in their development, albeit below the 4-year-olds. Then that tells you that even 3-year-olds could be enrolled in schools if a very focused curriculum program for them is put in place. And that's what we are put in place. I'm sure these panelists have had my colleagues present that we did an intervention program that children are having a very supportive, very friendly, and learning environment, including the caregivers, in this case teachers who are very well trained, retrained again on how to deal with the children. So we think this baseline will be augmented to better scores that will tell policy, that will inform policy in terms of, rather than having the 3-year-olds, because certain countries and states have already programs for the 3-year-olds. Essentially in Kenya, we don't have specific programs for the 3-year-olds. They are just in between weaning and school and anywhere they can be. So that's what we are saying. So systems that support the mothers, systems that also support the children to transit school. Thank you, sir.
Thank you so much. So happy mother, happy household, empowering the mothers, comfortable children. So those are very key. I wanted to open it up to the audiences in terms of if there's anyone who has a question. Anyone with a question?
Yeah, my question goes to the last person. I think I was a bit late. I never got your name and the county that you come from. My question goes to you. You talked of, since the budget allocation for school feeding program cannot be sustained, you looked for homegrown solutions to that, and I think you talked of every parent providing food to the schools. Is it annually or termly or what? And what do they provide?
Thank you. Okay. So I think you can take note and then we'll answer at once.
Thank you. I'm from Bungoma. My question goes to my neighbors from Busia. I don't know for how long this program for feeding has been on, but can you cite any success stories in terms of increased enrollment, retention, transition after this program? Because I look at your figures, you have only around 35,000 children, 45,000 children in a whole Busia County.
Thank you.
Thank you so much to our presenters this afternoon. Really excited to listen to the multi-sectoral approaches to nurturing care. I would want to hear more because these are, quite a number of integrated approaches that we are putting together in a bid to bolster the outcomes in as far as early childhood development is concerned. But there are very specific examples of combinations of these interventions that yield the most impact, right? So is it when you combine WASH with food security, with capacity building of the teachers that you get the best results? So which sort of combination yields the best results? If one has to replicate this and doesn't have all the resources to, put all these interventions together. And my second question, and this goes to Siaya and Busia counties, what exactly is the cost per child? I mean, if you want to replicate the model in another county, for example, when you put together all these costs of procuring the food stuff, the cost of what the parents are contributing in kind, the cost of the human resource bit of it, how much is that in terms of cost per child? Thank you.
Thank you. I think we can take the last two.
Thank you. My question goes to Mr. Baraza on personal responsibility for food handling. What measures are in place to ensure that food handlers are properly satisfied in food safety and hygiene? And On the same note, what strategies exist to enhance their motivation and working condition given their critical role in supplying children nutrition and learning outcomes?
Thank you. So I think we can take, let's take the last one. Dr. Baraza, I hope you have taken note of the last one. I missed out, so okay.
Okay, thank you so much.
Okay.
I'm also directing my question to Dr. Baraza, and one has just been asked, so I'll skip that one. Just on parental engagement, they are bringing in beans, 2 kgs of beans. What happens to those who cannot afford to bring? What are the measures that are taken to them, or how are they helped? And then he also talked about they are working in partnership and collaboration with NGOs such as World Bank. If the county government of Busia is providing rice and the parents are providing beans, what role do the NGOs do? What do they provide? Because there's also an allocation of 40 million. So what do the NGOs, how do they support the feeding program in your county? Thank you so much.
Thank you. I think now we can go to the answers. So, Honorable Beatrice, you want to go first?
Yes, let me,
okay.
Then he'll respond. I think I'll respond on I think there was questions about the impact of the program, if I gathered the 2 questions. I think maybe we didn't forget it very clear. From the beginning, we said that, yes, these programs are right now ongoing, but I think this is a research proposal, and those are the things we'll want to be looking into in our research that we are going to be doing. We want to look at the impact. Yes, it's happening, but what is the impact in as far as, and she's heard her talking about the ECD, the Institute of Early Learning, Health and Nutrition, safety and security. So we want to see in this space of the school meals programs, what impact do they have on ECD? On what talk about the milestones, and we have to come up with some indicators in our study that will now highlight what you talked about. What combination works well in as far as ECD is concerned? And so this is a proposal. We are at a proposal stage. Once we go to the field and do a research, maybe in the next conference, we'll be sharing our findings so that will inform a lot of decisions, because we are all being asked the same thing. Now, and very soon we're launching the school feeding policy at the national level in the devolution conference. So we are also looking at all this and saying, we know as much as counties are all doing all this, what's the impact on ECD? Thank you.
Thank you, Aziri, for that. Our viewers and my colleagues, I just want to start with my good friend. My name is Dr. Baraza. I'm an ECD expert and a specialist in this area of focus. I just want to say that before you arrive to parents to bring beans and rice, it took us a lot of time to do sensitization and capacity building. We had to engage all the board chairs. We had to engage all the teachers concerned for a whole week workshop to indicate and tell them what will be their role in the school feeding program. So every parent, every teacher that is in our setup, they are aware of their responsibilities and roles. Having said that, we also had a ratio, as I indicated to you, we only need 6 kilograms. Now, I would want to marry with another question with somebody who's asking, if somebody does not provide that. What we have encouraged, you can be able to bring the 6, you can be able to bring 1, and we have never missed beans. I can categorically prove that all the parents, after that sensitization, capacity building, they are really responding effectively. Now, my good friend was also asked from I hope it's from Siaya. The voice, I didn't see the face, but the face was looking like Siaya. The role of NGOs is, there are 2. Some of them have supplemented the beans in some quarter, in some regions. Number 2, these NGOs, like the NICE ecosystem program, have supported us the kitchen gardens. where we have been able to even grow vegetables to support even to make the meals to be more nutritious. We have been able to also plant fruit trees so that we are able to be able to support the learners with other ingredients. And we are calling more partners. You can still come and we partner with you and be able to. And also the NGOs and other who are in the nutrition ecosystem, they provide seedlings for parents even to plant, so that we don't want to have a scenario where that there's no provisions of the beans, provisions of what the children should be able to eat in school. So all that is taken into account, and we have done the sensitization to our communities and other players, including MCS, including our overall board. You know, in our policy, we have an apex that chairs the multi-sectoral approach, where we have all the departments concerned. We have health, we have agriculture, we have social protection. All of them are plus finance, because we cannot do without finance. They are all in our apex committee that makes decisions on how to move together. Now, also I want to retaliate that as we provide these meals, safety is granted. One, the policy is that according to the our meals and nutrition policy, it indicates that for the cooks to provide services to the learners, they must be certified with the public health. So all of them have certificates. And they, after every term, there's a team from health to see that there's compliance, so that all our service providers conform to that. And they have had a minimum space to ensure there is cleanliness, there's safety, and there is proper storage of our foods. Having also said that, we have engaged even nutritionists. In education, we don't have nutrition, we are only officers. But nutritions come from the Department of Health, whom we collaborate with them to ensure that the standards are made and everything is an appropriate standard that's made according to the health manual. So we have also developed a manual of safety on foodstuffs. If you want to, you can still come to Busia, I will give you one, so that you are able to ensure that all, like even rice, so that aflatoxin does not invade the rice. We have ensured before students consume, it has to be taken to the laboratory to assure us the safety and the credibility and the suitability for the consumption. I think, have I answered all questions?
Yeah, thank you. I think the only question for Dr. Baraza, I think there are two, where you were asked the contribution of the parents. Is it timely or what's the frequency?
I said you can either bring once the 6 kilograms, or you can bring per term one, according to your ability. So what am I trying to indicate is that there are parents who bring once. So those who have not brought, who are still lagging to bring, they will bring at appropriate time and it fits in the system, so that there's no way we shall have ever missed to serve our hot meal.
Thank you. Thank you. And I think the last one was the cost per child for the feeding program. I know if it is something that will require analysis, maybe you can...
that one we can share later. But what I can remember very well, the nutritionist gave us the standard measure that we provide 200 grams of rice, 100 grams of beans, and 0.05 mils of salt, and 0.5 mils of cooking oil. That one I remember very well. But now, and some few vegetables. So, but now the cost per child, I think I can still find out from my nutritionist, then I will share with you appropriately.
Sure, thank you. And I think,
Let me give the cost.
Okay.
Okay, like CIA, what we do, we serve 33 grams per child per day. That is for fortified flour. And if you calculate that, you will realize we use 1,575 for a term, a child. You can divide that and get. That is a guidance. 1,575 shillings per term. Yes.
Thank you. Thank you so much. So I think the last question that I feel like was not responded to was the specific examples of coordination that yielded best results with very minimal cost.
Okay, I'll give the coordination. Basically, the three main coordinators are health, education, and agriculture. Then you add finance for budgetary allocation. So those three main, because agriculture will produce, health will give guidance on health issues, then education will implement the program. Thank you.
Thank you. Charles?
Yes, I wanted to just also put in that issue of multi-sectoral approach. I know when you look at the causes of other nutrition, we have different pathways. We have disease and we have maybe inadequate dietary intake. So sometimes you look at combining different approaches depending on the context, because contexts are varied. For example, go to Nyeri and Moranga, where there is sufficient of food. But do they have other nutrition? We have overnutrition. We are struggling with obesity. We are struggling with issues of diabetes. Not that there's insufficiency of food. But when you come now maybe to arid and semi-arid areas, what are we struggling with? Undernutrition of under 5. So again, looking at all that, but more importantly, to point out, any programming requires also to have a component of behavior change. Having key messages that will influence the desired change behavior so that people can be able to adopt and live without that problem in the community.
Thank you. Thank you so much. And I think now we wanted to come to the conclusion of this session. And I wanted to give the panelists 1 to 2 minutes each for the closing remarks. And I will start with the virtual team. Dr. Uko, 1 to 2 minutes for your closing remarks. Dr. Uko, or you have already closed your session? Okay. Shizuko, we can now come to you for your closing remarks.
Thank you very much for valuable, very interesting discussions. And what is different from Kericho, apart from the other panelists, where they come from, it seems to be we don't have a lot of funding, but in our project is running a 100% sustained by parents ECD feeding program, which is a snack. And we have a record of more than 5 years of sustaining that program in almost 30 ECD centers in Kericho County. And then very, very low cost feeding program. If it's a snack, it could be possible to be initiated very easily. So that is what I just wanted to add to everyone and then the panelists and the audience. Thank you very much for valuable discussions. I appreciate it.
Thank you. Thank you so much. I will now come to the physical panelists, and I will start with Dr. Baraza.
Thank you, Yusuf, for this opportunity. I want to just call upon in this meeting that let us embrace school meals and nutrition, because where we find that our homegrown school meals and nutrition powered by local farmers create vicious cycle that stimulates address food security. Also, it stimulates good health and adequate nutrition, and also gives an opportunity for proper learning outcomes through opportunity for early learning, and also it helps us to develop economically and also maintain our environment. So if we can be able to engage and support school meals and nutrition, even our environmental degradation will also reduce, and reduce even carbon dioxide. Thank you.
Thank you. Honorable Beatrice.
I think I just want to add my voice to what Director said. I think the opportunities, I think for me, it's a call out for the ECD network. The opportunities as in the county governments through the school meals, as he's talked about. Actually, when you look up the school meals, the way we are doing it, if you use the material approach that we've discussed, you'll find that a lot of these, the 5 pillars of nurturing care framework can actually be, they'll be achieved. And so let's leverage on the school meals, even as we talk about ECD. In ECD, we have success in the school meals program. Thank you.
Okay. Thank you. Thank you.
I would say multi-sectoral approaches can effectively tackle complex development challenges when properly implemented with community ownership. So let us embrace school feeding through multi-sectoral approaches involving the community and the stakeholders around. That is all departments, plus the Ministry of Education, the Interior, the political wing, then we'll be home and dry. Thank you.
Thank you. Charles?
Thank you. Talking now from a programming perspective, where we know that the donor funding is shrinking day by day, much recognizing that as UNICEF, we are also faced by the same challenge, then it calls all of us to engage and to combine efforts so that we are able to pull together, work together as a team to be able to sustain not only whatever programs we have already initiated, but even the others that we can be able to come up. And again, being innovative in approaches that we undertake so that we can be able to have impact interventions that will lead to improved early childhood development for our children. Thank you.
Thank you. Thank you so much. I think I can give one final chance to Dr. Uko to see if he's back online. Dr. Uko?
I'm back online, and thank you for indulging me, Chair. I wanted to put one thing.
Sorry, Dr. Uko? We lost him? Okay.
Called that there's an intricate connection. I wished that we pick it from here as childminders. That cannot if we do not. You are not.
Dr. Uko, we can't hear you clearly. I think you have some network problem. Can you hear me? Dr. Uko? Okay. Thank you so much. I think we came to the end of the session. The key remarks, closing remarks from my side is mainly what was coming out from the panel discussions, multi-sectoral approach to, integrating health, nutrition, education, and also multi-sectoral coordination and collaboration will be very key for strengthening, ECD systems. So, thank you so much, panelists. Thank you so much, our audience. I think that's the end of our session. Have a good day. Thank you. Yeah, sure. We need to take a group photo. And I thought we need to take one with also the audiences.